Yes.
SBP, Neri.
No, ang sasagot po, ang USEC kabutahe patungkol po sa ano nga ba ang epekto nitong excuse me, PCB vaccines in preventing the increase of pneumonia cases. USEC Mirna.
USEC Kabutahe, you are now recognized.
Thank you, Madam Chair. On the first note, what is the incidence of pneumonia? Tama po si SBP Neri, yung ating pong top leading causes of morbidity ay based ho sa public health systems data. Ito po yung kinukuha sa mga Philhealth Services Information System na kinukuha sa mga different RHUs. So we have for 2020, meron tayong 46, number 7 po siya sa top leading cause of morbidity. Mas marami po nung 2019, 132,000 tapos 46,846. Ano po ang epekto ng pagbabakuna? Iba po, dalawang klase po ng bakuna ang pneumococcal. Meron po yung sa mga bata, sa 9 to 59 months old, yung tinatawag po nating pneumococcal conjugate vaccine, 3 doses po ang binibigay sa mga bata. Tapos po sa matatanda, meron tayong pneumococcal vaccine din na based sa batas ng senior citizen ay ibibigay natin ng libre sa mga indigent senior citizen. Nakikita po sa pagbibigay natin ng pneumococcal conjugate vaccine sa mga bata, bumababa po ang incidence ng pneumonia among children. But it does not cover after the 6 to 59 months age group. Tapos sa mga matatanda naman po, hindi natin nako-cover ng 100% yung target kasi nga yung mga indigent senior citizen lang po ang provided by law na pwede nating bigyan ng pneumococcal vaccine. But bumaba po sa mga bata yung incidence. Hindi kagaya po noon na number 1, number 2 ang pneumonia sa mga bata. Ngayon po bumaba because of the pneumococcal conjugate vaccine. Maraming salamat po.
Maraming salamat po, Madam Chairman, doon sa sagot po nila. Pangalawa kong concern particularly dito sa sinasabi po ninyo na magkakaroon po ng malaking deficit sa next year, particularly dito sa pera ng Philhealth. And binabanggit din po ninyo doon sa benefit payout, lalaki dahil po sa COVID-19 related. Pero, Secretary, in one of the hearings ng Congress, mang concern po ng marami pong mga ospital, kakaunti po yung nagpapa-hospital ngayon compared dun sa pre-COVID. Dahil natatakot po sila na magka-COVID po sila kapag pumunta sila sa hospital. So usually, ang binabanggit po ng mga private hospitals na mas marami, halos lahat yung mga related sa COVID. Pero for non-COVID related, wala halos ang pupunta sa kanila, kaya gusto na nga raw nilang iba ay magsasara na raw sila dahil kakaunti yung pupuntang mga tao sa kanila. So, hindi ko po maintindihan exactly. Ano po ba yung tama dito na datos? Marami po bang pupunta sa hospital ngayon kaya mas maraming makiklaim ng benefit package sa Philhealth? O marami related lamang sa COVID-related pero kaunti for the rest?
Madam Chair, again with your permission, Philhealth, who holds the data on the number of COVID cases that they have so far paid out to the hospitals as against the non-COVID cases, and if there is truth that the non-COVID cases have dropped, that is an information we would like to request Philhealth. Thank you, Madam Chair.
Thank you very much, Madam Mr. Secretary. Salamat for that particular assurance na yung binabanggit po nila na magsasara halos ang Philhealth dahil malulugi dahil sa dami po na mag-claim. And in fact, that's not true dahil yung sinasabi po ninyo, based on your data alone, yung non-COVID bumagsak. ang tumataas lang yung sa COVID-related. Third item po, Mr. Secretary, with respect doon sa pinag-usapan din natin nung last budget hearing, doon sa paggamit po ng national ID, dito sa uh, pagbibigay ng benefits under the UHC. Nung nakaraan po, kasalukuyan po kasi, I understand, nagkakandak pa rin po kayo ng membership para sa lahat po sa mga Pilipino to make sure na covered po sila ng Philhealth. Although hindi naman po necessary yun, pero I understand this is part of administrative process. Pero I understand gumagamit pa rin po yung Philhealth ng sarili pong datos. That's the reason why doon sa mga hearings po sa Senate at sa House din, nakita po natin yung maraming mga pangalan na matatanda na, 100 plus na, old na, pero nandun pa rin kahit matagal ng patay. So, ang tanong ko po, bakit kailangan pa po na gumamit po ng separate na data ang PhilHealth? Bakit hindi na lang po yung national ID po ang gagamitin po natin? Same concern as I mentioned last year, and sabi naman po ninyo na we will really endeavor to use yung national ID natin dahil naka-roll out naman po ito.
SBP Neri Santiago, you are recognized.
Thank you, Madam Chair. Thank you po, Congressman Salo. Regarding po dun sa data natin pagdating sa membership, we've been collaborating with PSA po regarding dun sa sharing of data. Sa ngayon po kasi ang medyo ang nagiging pag-uusap po ay kailangan po namin magbayad sa bawat dato na ipapacheck po namin sa kanila regarding po dun sa halimbawa kung pumanaw na or yung mga bagong panganak. We've been collaborating with them po, and based on dun sa pag-i-implement nila ng national ID, bali, this year po, they are targeting, based on yung discussion namin with them, is magpa 5 million po sila na mabibigyan ng national ID. At yun po ang gagamitin namin. At hopefully po, nasa law naman po na magkakaroon ng data sharing at no cost. So hopefully po, yung gastos na kakailanganin namin na kasama ngayon sa pag-uusap ay hindi na po kakailanganin pagka na-implement na po natin itong national ID system.
So ibig sabihin po ba magiging basis na rin po natin yung national ID? So hindi na rin po kayo gagamit ng separate data po ninyo?
Congressman Salo, you already consumed your 3 minutes. Last question na po.
Yes, last question ko po. Bago po yon, bago niyo po sagutin po yon, ito po yung huli kong tanong. Very simple lang po ito, Secretary. Sumulat po nung August 29 si Bishop Paul Hernandez po sa inyo as head po ng Interagency Task Force for the management ng emerging infectious diseases. At nakikiusap po siya on behalf dito sa guidelines po natin sa kasalukuyan with respect to religious gatherings. I was just wondering kung may tugon po kayo rito at ano po yung tugon po ninyo sapagkat lumalabas po based doon sa kanyang sulat, mas maigpit kayo di hamak dito sa mga religious gatherings kaysa doon sa mga pogos na sa pag-aalaw. And ang sinasabi naman po nila, they will strictly follow all health protocols issued by the government.
Sa ngayon po, ang patakaran ng IATF ay hindi pa rin po naman nagbabago. Yun ay 10% or under the GCQ, yung 10% ng capacity, yun lang po ang pwedeng magsimba or manampalataya at dahil po sa malinaw naman ang kadahilanan na ayaw po natin na magkaroon ng hawaan sa mga nagsisimba dahil marami po tayong karanasan dito na nagpapakita na sa mga places of adoration ay talagang sanhi po ito ng mabilis na pagkalat ng COVID-19. Kaya yan po yung ating health protocol at yan naman po ay sinusunod at ito po malinaw naman ang basis natin. No? So yan lang po ang masasabi ko. Unless, Madam Chair, Yusek Vergere would like to add something to it, if she has anything more.
Yusek Rosette.
Yes. Good afternoon po, Madam Chair and Congressman Salo. Aside from the 10%, meron pa rin pong restrictions ang senior citizens, those older than 60 years old and those the children, no, yung less than po nung age requirement natin para sa mga bata sa pagpunta pa rin dun sa religious gathering na pinapayagan po natin under GCQ level of quarantine.
Maraming salamat po, Chairperson. Ang pakiusap lang naman po dito ay consider po yung kanilang sulat at pag-aralan maigi as much as ang sinasabi rin po nila dito. At least yung religious freedom ay klaro po yan sa konstitusyon. At hindi naman po nila sinasabi na hindi sila magkukomply with all the health protocols po ng pamahalaan. Ang sinasabi lang naman po nila dito is for them to be allowed to have an increased number doon sa pagkakaroon ng physical attendance in church services. Thank you very much, Madam Chair. Thank you very much, Secretary. Thank you very much to the DOH family.
Thank you, Kong
Thank you,
Salo.
Kong Salo. The next one to interpret is Representative Ferdinand Gaite with additional 3 minutes given by Congresswoman Geraldine Roman. Representative Ferdinand Gaite.
Salamat po, Chair, at isang magandang hapon sa lahat ng ating kapwa-mambabatas, ang ating mga kapitapitagang mga bisita mula sa Department of Health. Madam Chair, may mga ilang katanungan lang po ako kasi nung bago po itong pandemya na ito sa aking isang privileged speech, nabanggit ko na ang isang problema ng krisis sa serbisyong pangkalusugan. At isang dahilan dito ay yung kakulangan ng ating mga manggagawang pangkalusugan na nagbibigay na direktang serbisyo sa mga mamamayan. Unang pong tanong, meron pong increase ang budget ng Department of Health, lalo na sa usapin ng ating Human Resources for Health, from 10.0 billion noong 2020, tumaas to ng 16.6 billion or an increase of about 6.6 billion tinaas. Patungkol po dito, Madam Chair, banggit po dito na may 14,000 plantilla positions na hanggang ngayon ay hindi nahihirapan ng Department of Health at mga public health facilities na punan nito. Hindi ba paulit-ulit na lang ang ganitong problema ng Department of Health? This is not the first time na na-raise itong concern na to. Yung problema ng understaffing na umaabot nga ng tens of thousands. May bago bang plano ng Department of Health para rispahan ang pagpuno ng mga posisyon, lalo na sa panahon ng pandemya, Madam Chair?
DOH.
Yes, Madam Chair, I seek permission to recognize Yusek Tong An, the head of the Admin Finance Management Team.
Yusek Tong An, you are recognized.
Yes, Madam Chair, thank you. And to our good congressman, gusto ko lang pong linawin na yung field positions po ng Department of Health is 62,004. Then yung unfilled po is 12,393. So may mga hindi napifill upan po kaagad. Why? Because ito po yung mga rason bakit hindi napifill upan kaagad. So may mga separation from the service of incumbents. Example is yung retirement, resignation, and transfer, and the others. Tapos po, pangalawa, bulk of the vacant items are physicians, especially medical specialists and medical officers, due to the following. So there is a low uptake or no takers. Some have private practice that they cannot compromise. Then, yung mga position po ng Medical Officer 3 at saka Medical Officer 4 in all levels po ng Level 3 hospitals are used for the residency program and fellowship program of the doctors. And temporary appointment were issued with these medical specialists, MO3 and MO4. The medical officer 3 are used for residency training program, while the medical officer 4 positions are intended for doctors who are on the last year of residency training or who are undergoing fellowship training. Yung iba po, kagaya ng physical therapist, speech therapist, PCCs, mahirap pong i-fill up kasi lumalabas po sila ng bansa. Sa mga nurses po, na fill upan natin halos lahat together with mga midwifery positions at saka nursing aid. So yun lang po. Salamat.
Kong
Yes,
Ferdinand.
Madam Chair. Salamat po, Madam Chair. Medyo hindi ko lang masyadong maintindihan kung sinasabing retirement dahil ito ay bagong vacancy. Ang pinag-usapan natin yung long-standing problem na malaking bahagi ng posisyon, kaya nga nabanggit ko crisis sa health services, na hindi pa nga sila nagre-resign, meron ng kakulangan ng posisyon mismo na pinunuan sa Department of Health. Hindi ba ang isang rason at I think tama naman yung sinabi ng ating mga kinatawan sa Department of Health, hindi na fill upan yung ilang positions kasi they choose to work outside. Ang reason kaya ay dahil maliit ang sweldo. You mentioned PT, physical therapist. I looked in the plantilla positions, salary grade 9. Lisensyadong practitioners ng PT to, and you only offer a very low salary grade level, no? SG9. Ang nurses natin, because of the new law, is now salary grade 15. Isang main reason ba ito, yung problema ng mababang pasahod, Madam Chair?
DOH.
Yusek
Yusek
Tongan
Tongan.
again.
Salamat po. Sa nurses po, yung sa batas na Nursing Act 9173, ang salary grade entry po sana noon is salary grade 15. So for 18 years, pinaglaban po ng mga nurses kasi ginawa pong SG11. So ngayon po, nanalo po sila sa Supreme Court, lumabas po na tama po yung salary grade entry SG15 na po ang nurses. For physical therapist po, SG15 po ang entry nila. Thank you.
Okay, salamat po, Madam Chair, clarification na yun. Kasi iba'y nabasa ko na PT item sa ilang government hospitals na nag-hire ng physical therapist. Pawang napakababa. So ako tanong, patungkol pa rin sa pag-i-empleyo ng ating mga health workers. Nabanggit po dito sa bagong budget, sa presidential budget message, ang sabi, mag-hire ng mga emergency hires. Tanong ko po, ano ho bang katangian ng trabaho to? Contractual po ba, Madam Chair?
Dalawa pong classifications ito, Madam Chair. Isa pong contract of service at saka isa pong job order. So yung detalye po nito, ang bilang ng ilan ang contract of service and job orders, magagaling po kay Yusek Tongan.
Kong Ferdinand.
Madam
Yes,
Chair,
Madam Chair.
Yusek Tongan to respond to the
Yusek
question.
Tongan, you are now recognized.
Thank you, Madam Chair. Yung sa job order po natin, kasalukuyan, na hinar po sa emergency hiring for COVID-19 response ay as of September 3 po, nakapag-hire na po kami ng 7,495 po. Hired out of the 10,065 approved slot for the emergency hiring ng 313 health facilities all over the country. So, yun po. Salamat.
Kong Ferdinand.
Yes, maraming salamat. At medyo nabahala kami kasi doon sa unang figure na binanggit. Although sinabi nyo ngayon 7,495. Doon sa original na data na nakuha namin, 857 lamang ang nag-apply sa emergency hiring program. So ibig sabihin po, doon sa binanggit yung 1,000 positions, meron nang napunuan dito, Madam Chair.
Yusek Tong-an.
Thank you, Madam Chair. Opo, sa kasalukuyan, continuous pa rin yung pag-hire namin ng ating emergency hiring. So ito ay kasama po yung mga nurses, doctors natin, physical therapists, and mga encoders po. So yun po yung mga kasama dito sa emergency hiring natin. Salamat po.
Salamat, Madam Chair. Isa pa kong katanungan tungkol po doon sa binabanggit na additional 26,035 health workers na nakatarget for hiring mula doon sa binabanggit na 16 billion. But of course, I think yung increase ng 6 billion sa budget will be for the implementation. Nabanggit nyo yung nurses na upgrade. Ang mga position na ba itong i-hire ay mga regular rin po ba o contractual din, Madam Chair?
Yusek Tong-an. Contractual daw po ba o permanent na?
Ito pong sa emergency hiring po ay contractual po ito, but based on the policy, prioridad po sila kung may mga bakante sa mga hospitals natin at saka ibang health facilities sa bansa. Thank you.
Thank you, Madam Chair. Yung nga pa rin ang hindi ko ma-reconcile. Kung umaabot ng tens of thousands ang vacancies, 14,000 ang regular, bakit hindi pa punuan? The crisis, even before the pandemic, has been evident sa health services. And yet, pinipili pa rin na mag-hire ng mga empleyadong hindi regular. Anyway, yun yung gusto ko rin makita. Ano bang rasyonal hinggil dito? Kaya lumalabas na niniwala ko maraming hindi nila sinasangayunan na ma-hire na ganito sistema. Pangalawang tanong, sumunod na tanong, gusto ko pong inquiry po tungkol sa programa ng Philhealth, lalo na sa hemodialysis program ito. May reklamo pinarating sa amin ang opisina ni kagalang-galang Congresswoman Geraldine Roman na sa Region 3 daw, ang mga hospital daw, pinatigil daw ang pag-cover ng dialysis treatment ng Philhealth. This was before Bayanihan 2, but as I understand, naglabas ng September 15 ang kautusan o di kaya isang press release na sinasabing tuloy lang ang pagbibigay ng hemodialysis as covered under PhilHealth. Natigil pa ba talaga ito prior to Bayanihan 2's implementation, Madam Chair?
SBP Nery Santiago.
Thank you, Madam Chair. Thank you, Congressman. Hindi po natigil. Ito pong pagbibigay natin ng dialysis. At maski po lumagpas na po ng 90 sessions, i-cover pa rin po natin. Bago po Bayanihan 2 na signing into law, may September 15 naman po na hanggang kailan yung declaration of state of calamity. So, hindi naman po natigil. Salamat po.
Madam Chair?
Kong Ferdinand, that will be your last question po.
Isa lang po, clarification lang po. Kasi may nabasa nga akong post ng PhilHealth sa kanilang Facebook page na kung hindi natigil, bakit they had to announce that the privileges for PhilHealth hemodialysis patients ay pagpapatuloy pa. So, ito ay nakuha ng reklamo na nirelay sa amin ng opisina ni kagalang-galang Geraldine Roman ng Bataan. Kung kaya't ito ay, alam naman natin hemodialysis, no? More or less every 2 or 3 days. Hindi pwede mag-miss. At kapag na-miss ay mas malubha ang epekto, implikasyon. Kaya po binavalidate namin yung information na ipinaabot sa amin. Finally, as a manifestation, we take exception to the circular, although this was not issued by the Department of Health, but by the Department of Budget and Management. But I believe dapat yung Department of Health had made their position known, but apparently they agree doon sa nangyaring downgrading or demotion of our nurses na mas mataas sa Nurse 1. Hindi po totoo yung sinasabi. sagot ng ibang sa reklamo na ni-raise ng iba nating Congress representatives na hindi demotion yung nurse 2 and all up to nurse 7 na binaba sila, dinowngrade effectively or dinemote. Hindi totoo na dahil lang binago yung numerical nomenclature ng nurse 1, yung nurse 2 ginawa na ring nurse 1, yung nurse 3 ginawang nurse 2 and so forth and so on. Because even in Supreme Court decisions, not only is a demotion, the diminution of salaries is considered a demotion, but also the functions. Ibig sabihin, kung dati ikaw ay nurse 2 at ikaw ay nurse staff at ikaw ang nagtitrain essentially ng mga nurse 1, lalo na yung mga wala pang experience, na downgrade ka kasi ikaw essentially tinitrain ka na naman and so forth and so on. So may mga functions yan na may
Kong Ferdinand, nawala po kayo. Kong Ferdinand, nawala po. The next one to interpolate is Representative Ria Vergara.
Thank you, Madam Chair. Good afternoon to Secretary Duque and to the members of the
Good afternoon.
Department of Health with him. Madam Chair, my first question is actually related to the issue you raised when we first started the hearing. There seems to be an overall trend across all hospitals in our country that's not serving corona to have a decreased budget. And, the WHO said that because of the focus on corona, this and non-communicable diseases like hypertension, diabetes, cancer will be increasing worldwide. May I ask, what is the DOH doing to address this, given the limited funds that it has and with so much of it going to fight corona?
Secretary
Thank
Duque.
you, Madam Chair. The DOH has resorted to the implementation of the telemedicine, teleconsultations. Part of our overall e-health strategy, we realized that there has been a significant drop in the number of patients suffering from non-communicable diseases such as cancer, hypertension, diabetes, etc. There has been anxiety and fear amongst our people, the patients, to go to the regular outpatient departments of various hospitals and medical centers. So meron po tayo ngayon mga telemedicine, teleconsultation. I think we have about 66,000 more or less total consults through telemedicine or telehealth. So this is one of the measures to precisely address the lack of physicians who are unable to attend to the patients on a face-to-face basis. So tawag na lang po. So we have for non-COVID, I think even more teleconsultations that happen. And then for the COVID, about close to half of the total 66,000 plus teleconsults. Maybe Yusek David might want to add more to the data that I have articulated.
Yusek David, you are now recognized.
Thank you po, Madam Chair. So, during the COVID po, we assisted our DOH hospitals po by providing them additional MOOE po. We downloaded some money for them to be able to provide the COVID response that's needed in their hospitals. And we also provided them supplies po. and some equipments for them to be able to respond to COVID. Sa atin ho namang mga teleconsultations, we were able to attend to more than 52,000 teleconsultations po ang ating nagawa. And from 25,625 po are COVID-related po out of this.
Yes. Thank you, Madam Chair, for that information. But what I was specifically asking for was like for those who are doing chemotherapy. I know of somebody who used to be enrolled in the DOH program because he's AIDS, HIV positive, and the retroviral or whatever that medicine that the DOH used to give for free. He said stop. So I hope they can look into this and to make sure that this programs that existed before can continue now that our economy is slowly opening up. My next question, Madam Chair, is I'm wondering how did the DOH arrive at 2.5 billion for the coronavirus vaccine once it becomes available, or it's just a ballpark figure? It can actually go higher or lower depending on how much the vaccine will actually cost.
Yusek Kabutahe, you are now recognized.
Thank you, Madam Chair. The initial computation for the 2.5 billion are the prioritization of the beneficiaries of the immunization. So they were limited to our frontline health workers, those who are in the hospitals and public health facilities, our other frontline our healthcare workers in the DepEd, in the DSWD. We computed the actual figures and we came up with 2.5, a total of 3,871 eligible population for immunization, which included senior citizens. That's why we were able to compute that 2.5. But upon the instruction of the President that he wanted 20 million population, then we adjusted the computation to include our senior citizens, those medical, most at risk population, which includes our male population, 12 to 59 years old. And so it's really allocating the prioritization on which age groups and the numbers that need to be immunized. This is on the basis of the WHO classification, but eventually we will find out in the clinical trials who will really be needed to be prioritized. Thank you, Madam Chair.
Madam Chair, thank you, but I don't think they understood my question. I understand who will be prioritized. What I'm asking is, how did they arrive at the figure of 2.5 billion? Is the assumption it'll be costing 10,000 pesos per vaccine? I know who will be prioritized. Of course, the frontliners, the people serving in government, senior citizens. But where did this number come from? So am I making sense, Madam Chair? How did they come up? I mean, what are they assuming the cost of the vaccine will be? I think that's a clearer question.
Yusek Kabutahe.
Yes, thank you, Madam Chair. Yes, I'm sorry for that. The basis for the computation, as I mentioned, are the actual number of frontliners, and we multiplied that by the cost which we found to be 305 based on previous experience with new vaccines and giving them 2 doses. It also includes a certain amount dedicated for syringes because we presume that this will be injectable, so we included the syringes so that it will come to a total of 2.5 billion, Your Honor. So it's 3,871 eligible population at 305 per dose, and we assume at 2 doses, so it's plus the syringes will total 2.5 billion.
So thank you, Madam Chair. So if it's 2 doses, it's fair to say like 610 pesos, assumption 610 pesos per dose, for 2 doses. As early as now, I hope that the DOH is already preparing on how they will roll out this immunization so that we don't have a repeat of what's happening now with the SAP. I mean, right now here in my district, we're still giving the SAP that was approved as a law last March, and we will not also experience what we experienced during the Dengue before it became controversial, where there were districts that were complaining how come they didn't get the Dengue when they have lots of dengue cases. Is the DOH already coming up with a strategic, realistic, sustainable strategy on the proper rollout of the vaccine for corona? Just a yes or no, Madam Chair.
Yusek Kabutahe.
Yes, Madam Chair. While the initial assessment is to give these priority groups, there are continuing studies on who eventually will be the target age group that will be immunized. But we are preparing for different scenario who will be immunized. So if this is the same age group that will be immunized, then we will roll it out through our different organizations, our different national government offices, and together with our implementors, we will be working in the rollout with, as I mentioned earlier, our PNP, our military, so that they can help us distribute the vaccines and be able to give them to the different beneficiaries. But for the initial rollout after the clinical trial, the instruction of the secretary is to pilot this first on a small scale so that we will know what's going to happen here, guided also by the results of the clinical trial, so that we can have some pilot testing before this is really massively rolled out. And then we will have risk communication on the benefits and risks of the vaccine. Of course, it comes without saying, as has also been mentioned earlier, that we will need to conduct safety and effectiveness surveillance aligned with surveillance reporting systems from other countries' regulatory authorities. And pinaka-importante po, tama kayo, we will need to engage with the community kung saan babakunahan yung mga tao, yung mga actually na babakunahan, tapos kung saan sila part of the community, so that we will tell them ano ba yung doses, ano ba yung side effects, para maganda po yung ating reception ng ating vaccination po.
Thank you, Madam Chair. I just have one last manifestation. I listened earlier to last week to listen to Yusek Tong An's explanation on the reason why the nurses did not get the higher salaries as they envisioned, while the reason of the DBM is there's no legal justification. It unfortunately coincides with the perceived neglect felt by our medical frontliners, especially the nurses. There's already an overseas deployment ban of healthcare workers, which is further deepening the wound of the very people we call our modern day heroes. An increase in pay is not about money. It is much more than that. Ito ang isa sa mga paraan para iparamdam natin sa kanila na mahalaga sila at tayo nagpapasalamat sa kanilang paglilingkod sa kabila ng mapanganib na kalagayan nila. I think, Madam Chair, that the DOH should already be exploring possible bilateral negotiations and policies with countries that recruit our nurses to bring about conditions that benefit our country, like compensatory measures requiring the recruiting hospital to pay our government for each new recruit they hire so that we can use this compensation to increase the salary of our healthcare workers who stay at home. This will help our government address and finance nurses' wages that choose to serve our country. I don't think there's anything wrong for nurses who want to go abroad, but if we can make it cost competitive to make them stay here, then I'm sure most of them would rather stay. Thank you, Madam Chair, and good afternoon.
Thank you, Congresswoman Ria Vergara. The next one to interpolate is Congressman Boying Remulla.
Thank you, Madam Chair. May mga katanungan lang po ako tungkol sa Philhealth. Ang unang tanong ko ho, gaano kahalaga ang Philhealth sa Department of Health?
Mahalaga po ang Philhealth being an attached agency of the DOH, and in the context of universal healthcare law implementation, ang Philhealth po ang siyang major financing arm or funding arm of the implementation of the universal healthcare, especially in matters of developing and
So, Mr. Secretary, you agree that Philhealth is very important to our health system. Talagang siya ang isang pivot, o maybe pwedeng sabihin kung apat ang paa ng Philhealth, baka dalawang ng DOH, baka dalawang paa niya nasa Philhealth. Would you agree with me?
Yes, I would say so. Dahil healthcare financing po siya, isa po siya sa apat na humahaligi sa universal healthcare
And
service.
Philhealth, the subsidy to Philhealth is the biggest given to any GOCC in this country. Are you aware of that, Mr. Secretary?
You're right, Your Honor, Madam Chair.
At ang pera hong ginagamit ng Philhealth ay hindi lang po subsidy ng gobyerno na nanggaling sa buwis ng taong bayan, kundi mga direct and indirect contributions ng ating mga mamamayan mula sa kanilang mga perang pinaghirapan. Tama ba ho yun, Mr. Secretary?
Tama po kayo, Your Honor.
Ngayon, kung meron hong nanloloko sa sistema ng PhilHealth, ano ho ang policy ng PhilHealth sa mga nanloloko sa sistema ng insurance natin dito sa Pilipinas, sa ating PhilHealth insurance? Ano ang attitude natin dyan?
Marami po tayong mga anti-fraud measures na idinagdag.
Gano'ng karami ho ang ating anti-fraud people sa loob ng PhilHealth? Gano'ng karami po ang ating inupahan para tingnan ang mga fraudster, yung mga gumagawa ng kalokohan sa pera ng taong bayan? Ilan po yan?
With the permission of the chair, may I please refer this to our SVP Neri Santiago or the President and CEO, Attorney Dante Geran.
SVP Neri Santiago.
Magandang hapon po, Kong Remulla, Madam Chair. Doon po sa bilang ng sa anti-fraud po na tao po sa PhilHealth, maliban po dun sa legal sector at saka yung arbitration department na nag-handle po ng mga kaso within PhilHealth, meron din po tayong standards and monitoring department na tumitingin po ng ating
Meron ba ho tayong fraud investigator na directly hinire ng PhilHealth para imbestigahan ang mga fraud sa mga ospital? Ilan po ang ating fraud investigator?
Sa ngayon po, ang nasa plantilla po is mga 120 plus na plantilla po, pero meron din po
Ilan po yan? Ilan po yan?
120 plus na plantilla po. Tapos meron din po tayong contractors na hindi ko po alam kung na-fill up po yung lahat po ng opening, pero mga 120 din po ito.
So hindi nyo alam? Ang sagot nyo, hindi nyo alam? Kasi hindi nyo sinasabi kung ilan.
Yung eksakto po, pwede po namin maibigay.
Ilan po yung eksakto? Ilan? Gusto ko malaman.
Mga 120 po yung contractors and the plantilla po is mga 120.
Ano hong qualification ng ating fraud investigator?
Doon po sa may meron po mga posisyon na kailangan po lawyers, meron naman po posisyon na hindi naman po kailangan na lawyers. Madam Chair.
But it's not an answer to my question. Ano ang qualification?
Kailangan ko pong balikan po kayo para doon sa kasagutan na yon dahil hindi po
Meron ba kayong
familiar.
college graduate, may experience sa police, may experience sa fraud? Wala ba kayong ganon? Basta kuha lang kayo ng kuha ng tao, tapos gano'n na lang yon? Ano hinahanap nyo para maging fraud investigator ang isang fraud investigator?
Hindi naman po, hindi college graduate. Kailangan naman po meron pong nakapag-aral po para po meron pong kakayanan na tingnan ng ating...
Saan mo nakasulat yan? Yung qualification as fraud investigator. Pakita nyo sa akin.
Sige po, i-inquire ko po sa aming HR yung exactong qualification po.
Sige po, kahit buong araw tayo magtanungan dito. Move to suspend, Madam Chair.
There's a motion to suspend and duly seconded. Hearing no objection, the motion is carried.
Mas marami po hindi.
Madam Chair, wala pa bang sagot? Ready na ba sila?
SBP Neri.
Madam Chair, pinapakonect lang po namin. Meron po kaming tao sa central office na nakikinig po. So, ipapakonect po namin. Madam Chair.
Okay po. While we're waiting for you, I would like to resume the briefing.
So hindi nyo ho alam, Madam Santiago, kung ano ang qualifications at kung saan nakasulat, kung ano ang hinahanap natin upang tayo ay kumuha ng fraud investigator para sa Philhealth. Wala ho tayong sagot doon.
Ako po, wala po akong personal na alam doon sa qualification.
Okay. It's just a reflection, Madam Chair, that we have a problem in Philhealth, that even the basic question of fraud investigation is not taken seriously by the leadership of Philhealth. Next question ko. Ano ang ginagawa nyo pag may fraud na nakomit sa Philhealth? What does Philhealth do? How many hospitals has Philhealth taken out of its list of accredited hospitals because of fraud? Ilan na?
Madam Chair, i-connect po natin yung nakakaalam po ng tungkol dun po sa fraudulent, yung lawyer po natin.
I'll ask the chairman of the board. What is the attitude of the board and the leadership of Philhealth sa mga fraud na kinocommit laban sa pera ng taong bayan? Ano ho ang ginagawa ng Philhealth tungkol sa fraud at ano na ang nagawa?
Secretary Duque.
Yes, thank you, Madam Chairman. The board certainly condemns all forms of fraud that is being committed by healthcare institutions and professionals. And we have a system in Philhealth that once a fraudulent act is committed, this is investigated by the the anti-fraud.
What is the punishment for fraud in the PhilHealth system?
Well, there is a suspension of the facility of its accreditation, one. Number two, there is also a penalty of, if I recall, about 50 to 100,000 pesos for each fraudulent act. Because there are many fraudulent acts which may range from extending period of confinement to
So ang
fining.
tanong ko ganito, so yung sinasabi nyo yan, no? Meron tayong penalties, meron tayong may suspension. Ba't marami ho tayong kaso na pinapabayaan lang natin ang fraud at pinafine lang natin at parang baliwala na sa mga ospital yung kanilang na-commit na infraction? Bakit po ganoon ang sa attitude ng PhilHealth sa mga kasong ganito? And specifically, yung mga ospital na nahulihan, nagkakaso, na desisyon na ng korte at pinabayaan lang ng PhilHealth na makawala at binabigyan lang ng fine na maliliit. Ano ho yan? Anong attitude yan sa atin sa PhilHealth? Talagang pababayaan lang natin ng mga ospital na gawin ang kalokohan sa sistema ng ating health insurance?
Kong Boying, wrap it up.
Chair, thank you. Yung
Secretary
pong,
Duque.
if I may, Chair, yung pong kasagutan dito, may ilan-ilan pong mga ospital, halimbawa yung mga malalayong mga ospital, na napakamahalaga po yung kanilang mga serbisyo, yung pong mga pasyente ay nakikiusap na imbis na isuspinde yung kanilang accreditation ng ospital, nakikiusap po sila through a collective appeal na kung pwedeng i-convert into higher fines instead of...
Madam Chair, I am not satisfied with the answer and the way that these questions are being answered. I will just see them in court. Thank you, Madam Chair.
Thank you, Congressman Boying Remulla.
Thank you, Madam Chair.
The next one to interpolate is Senior Minority Leader Congresswoman Janet Garin. You have additional 9 minutes given by Congressman El Rey, Congressman Pichay, and Congressman Alvarado.
Thank you very much, Madam Chair. Good afternoon to the DOH family headed by Secretary Duque. Secretary, malapit po sa puso ng mga tao ang bakuna, lalo na ngayong pandemya, at nakikita nga natin kung gaano kahalaga ang vaccination, especially when it comes to elimination of diseases. So my first question is that, sa pananaw nyo ba related yung kahalagahan na mura yung bakuna vis-a-vis sa pondo ng gobyerno?
Secretary Duque.
Can I, with the permission of the chair, can I just refer the query to Yusek Kabutahe?
Madam Chair?
Yusek Kabutahe.
With your permission. Opo, Madam Congressman, mahalaga po ang presyo ng bakuna kasi kung mas mababa po yung bakuna, mas marami yung presyo ng bakuna, mas marami po tayong mababakunahan.
Thank you for that, Madam Chair, Yusek Mirna. So sa ngayon pong programa nyo, ang narinig po natin doon sa ating previous hearing, you have a move to buy a cheaper pneumonia conjugate vaccine. Can you please expound on this? And can we go to the possible reduction in prices?
Thank you, Madam Chair. If the concern is about the pneumonia conjugate vaccine, that is given to the children, we have requested that a reassessment of the cost effectiveness of the PCV, considering that yung last na cost effectiveness assessment was done in 2014. Kasi po, may mga bagong studies on clinical efficacy of both PCV10 and PCV13 against vaccine type pneumococcal diseases na nangangailangan po talaga ng reassessment. Tapos po, yung new price quotations, because available na po ang multi-dose preparation ng parehong vaccine. Dati-dati po, single dose yung mga preparation ng PCV, kaya po ngayon, available na yung multi-dose, kaya po mas magiging mura. Tapos kung mas mura yung bakuna, mas marami tayong mababukunahan. Tapos i-expand na po natin para sa universal
So, Mr.
coverage.
Chair,
Yes,
with
ma'am.
due courtesy, Yusek Mirna, correct me if I'm wrong, no? Ang sinasabi niyo po, there are new studies na yung PCV10 comparable na sa PCV13. So for the record, pwede na siyang bilhin ng mas mura at ang sinasabi niyo ron, dagdag pa dito because PCV10 and PCV13, the comparison is a no-brainer. Hindi pwedeng maging mas mahal ang PCV10 kesa sa PCV13 kasi ibig sabihin nun, parang sinasabi mong mas mahal ang coffee in stick kesa sa 3-in-1. Diba? Ikumpara natin ang PCV13, parang 3-in-1, ito namang PCV10, coffee stick, pareho naman silang may kape at epektibo at caffeine lang ang gusto mo, mas mura itong PCV10. So, there are expected savings in the vaccination program. Dagdag pa dyan, sinasabi nyo rin that we are going to shift to a multi-dose vial rather than individual syringes. Again, that will entail huge savings. Am I correct in that interpretation, Madam Chair? Distinguished resource person. Tama po ba?
Madam Chair, may I be allowed to answer? Yes.
Yeah, okay. Thank you very much
Yes,
for
ma'am.
that. Nung nakaraang mga taon din, nagkaroon ng allocation ng 3 billion for dengue vaccine. This actually caused an increase in the vaccination, the National Immunization Program budget. I forgot, I think that was left, basta nagkaroon ng dagdag na 3 billion because of the dengue immunization program. Unfortunately, this was stopped. Ang tanong ko lang po, yung pondo ba ng 3 billion ng dengue vaccine ay tinanggal sa immunization program or it stayed? Naiwan?
Madam Chair, to my knowledge, hindi po siya nag-stay because we compute the vaccination based on the required number of doses, tapos ano yung cost. Ano po yung mga binibigay na mga bakuna?
Yeah, Madam Chair, if I may be allowed to rephrase, yung tanong ko po, there was a dengue vaccination program in 2016. This caused an increase of 3 billion in the budget for the National Immunization Program. Was this taken out when the dengue vaccination program was removed, or did this stay with the immunization program budget? Yan lang po. I don't mean any harm. I just want to establish that we have funding for vaccines.
What?
Simple lang po, Madam Chair, ulitin ko yung tanong. Ito yung pondo ng pagbabakuna. Nagkaroon ng dengue immunization program because of the infusion from the national government of 3 billion. So yung pondo, kunyari yung pondo 7 billion, naging 10 billion. Hininto ang dengue vaccination program. Did the money stay there? It's just actually yes or no.
The amount, Madam Chair, was 3.9 billion in 2016 and increased to 7.1 billion in 2017. But based on what was given to me, it was because of the increase the increase was because of the introduction of the pneumococcal conjugate vaccine, PCV. I am not aware if that price
Madam
was...
Chair, with due courtesy, we could not have introduced pneumococcal vaccine in 2017 because pneumococcal conjugate vaccination program started sometime in 2012 when the vaccines were made available, I think 5 years prior to the private sector. So it started with PCV-10 in 2012, and when PCV-13 became available, we shifted to PCV-13 and moving forward. I actually don't mean any harm. I just want to establish that the government is providing an increasing budget for immunization.
The answer there, Madam Chair, is yes.
Yes, okay.
Yes,
So
thank
we're
you.
establishing that the government infused 3 billion for dengue vaccine. When the program was stopped, the money remained, but it was still used for other vaccination programs.
For the Dangbaksha, Madam Chair, I just don't have the exact figures, but what I do recall is that since there was a significant amount of vaccines that were used in the immunization program, for which Sanofi Pasteur was the supplier of the
Yeah.
vaccine.
Honorable Secretary,
they were
if I
paid.
may, just to align, I'm not referring to the actual utilization. I'm referring to the government allocation for the immunization program. So balik po tayo. Nagkaroon ng pondo, let's say if it was 4 billion, that's the regular vaccination program. When dengue became a public health burden, nagkaroon ng bakuna, nadagdagan ng pondo. Nung tinanggal ang Dengue program, it remained as an increase, na dun yung pondo, hindi natanggal. Tama? In the succeeding years, I'm referring to the historical increase in budgetary allocation. What I'm pointing at is, kunyari, magkaroon ng COVID vaccine, nagdagdag tayo ng pondo. Ngayon, na-eliminate na yung COVID. Ando dun pa rin yung pondo na pwede nating gamitin sa ibang mga sakit. That's the very simple question that I have.
Yes, the answer to that is yes,
Okay.
Madam Chair. So lumaki po yung budget for the vaccines, and kasama po yung lahat po ng immunization program, iba't ibang mga klaseng mga bakuna po ang pinaglaanan.
Yes, and now that we have another increase in the immunization program, and coupled with the three factors. Una, yung ginawang pondo for dengue vaccine has been retained up to this point of time. Pangalawa, merong additional na dagdag para sa COVID vaccine in case it will be made available. Pangatlo, yung pondo para sa pneumonia vaccine, dahil magkakaroon kayo ng pagbibili ng PCV-10 possibly versus PCV-13, napakamahal ng costing ng PCV-13, savings, considering the same quantity for PCV-10, savings are expected to be generated, especially so if we're going to proceed to multi-dose preparation. What I'm pointing at is there is really a possibility, and that's why we are making budgets flexible para kung merong kailangan maging mura, pwede siyang gawing mura. Kung nagmumura naman yung bakuna, pwede mong i-expand yung gastusin sa ibang bagay. I just want to document that at to point that our government is really investing on vaccines for our people. Yeah. Moving forward to my next question, there was also the program on hypertension and diabetes. And if my memory recalls me right, nagkaroon po ng pondo ng 1 bilyon para po sa mga maintenance medication ng 3 million hypertensive patients and 1 million diabetic patients. Ano po ba ang programa na ito? There was an allocation of 1 billion for 3 million hypertensive patients and was supposed to increase, and diabetic patients totaling 1 million, a total of 4 million Filipinos. Ang intention po nito, every month, they go to the rural health center to get 1 month supply of maintenance medications based on the premise na napakamahal ng gastusin ng kalusugan at marami po ang hindi nakakabili ng maintenance medication. Ngunit marami po ang kasamahan natin sa Kongreso at yung ating mga kababayan ang nagtaka dahil nawala ang programa na ito at hindi na mahanap kung nasaan ang pondo nito. Can we have an update regarding that program?
Madam Chair, may I request that the chief of the pharmaceutical division be recognized? I think she's in the Zoom, Madam Chair. Her name is Dr. Melissa Guerrero. To be recognized with your permission, Madam Chair.
Yes, Madam Chair. So tama po kayo, Madam Chair, meron po tayong Medicines Access Program po dati, nakalodge po ito doon sa Pharmaceutical Division, pero bandang 2016 or 2017, lahat po ng pondo ng Medicines Access Program para po maging harmonize siya doon sa Non-Communicable Diseases Program, nakalodge na po ito sa Disease Prevention and Control Bureau po. I think tuloy-tuloy naman po ang pagbibigay po ng medicines for hypertension and diabetes.
With that, Madam Chair, Honorable Secretary, kasi naririnig natin na tuloy-tuloy, pero naririnig naman natin ang reklamo sa baba na tila nawala siya. Because it was a monthly, once a month visit to the Rural Health Center wherein the registered Filipino, indigent Filipino, kumukuha ng buwan ng gamot for maintenance medication for hypertension and diabetes. Ang tanong ko po, meron po sa programa ng DOH na wala ito dati, yung butika ng bayan, dahil napunta sa maraming utang at hindi nabayaran. Moreover, karamihan naman po kasi ng ating kababayan, walang pambili ng gamot. With the onset of sin taxes, sa pananaw niyo po, Honorable Secretary, ano po ba ang mas maganda? Yung pondohan ang butika ng bayan kung saan binibenta yung gamot sa ating mga kababayan, or pondohan na lang at dagdagan kasi marami naman yung may diabetes at marami yung hypertension, at kung kayo sa national government ang bumibili ng gamot, nagiging mura siya because of economies of scale. Do you think with this pandemic where people are losing jobs, where people are having a hard life, it will be better that the budget will just be spent and augmented on the hypertensive and diabetes club so that more patients, ibalik natin yung 4 million na Pilipino na buwanan pumupunta sa RHU at ibalik natin na madagdagan ito because 60% of our population in the adult stages are hypertensive. Sang-ayon po ba kayo kung sakasakaling magdesisyon ang Kongreso at ang Senado at ang Pangulong Duterte sa kanyang administrasyon na tulungan ang gastusin ng maintenance medications ng ating mga may high blood at may diabetes? Are you amenable to this?
Secretary.
100% amenable, Your Honors.
Thank you very much. Madam Speaker, Madam Chairman, punta po tayo, Secretary, sa COVID. Ang COVID po kasi, will you agree with me that the number one niche of population that they are attacking are renal patients? Yung inaatake ng COVID, karamihan, number one nilang target are renal patients or patients undergoing dialysis.
Well, we don't have a clear data on the matter except that we know the COVID attacks the vulnerable people, elderly with comorbidities, and renal diseases are a cause for concern in this age group.
Thank you very much, Madam Speaker, Secretary Duque. Ibig sabihin, talagang kailangan na magkaroon ng dialysis centers for non-COVID patients at hindi sila ihalo sa dialysis center ng mga pasyenteng may COVID. Kasi baka magkahawaan sila. Ang tanong ko po, ang dami pong dialysis centers na under sa PPP or public-private partnership. Ang nagiging problema po dito, kahit libre na binibigay ng Philhealth yung 90 sessions, dalawa ang problema. First, dialysis patients, renal patients, and I'm speaking on behalf of my husband who underwent renal transplant. Alam po namin napakahirap nung 3 times a week nagpupunta ka sa dialysis center at nag-aagawan ng slot. And the problem there is, that's why when I was chairman of the board, from 45 free sessions, I increased it to 90 sessions. And because Attorney Giran is here, maybe I can request him to revisit, because before I left Philhealth, there were already documents in place for implementation that 90 sessions should have been increased to 120 sessions the next year. Kasi yan po ang minimum number of dialysis sessions that each renal patient has on an annual basis. Merong pondo po yun, galing po yun sa PD First.
Congresswoman Janet, last question na po.
Yeah, Madam Chair, if I just receive calls from some colleagues for additional questions para po sa ikabubuti ng programa, if I may be given an additional time. So yung tanong ko po, kagaya sa Cavite, sa distrito ni Congressman Remulla, ang dami pong pasyente na nangangailangan. Pero kapag po'y PPP, ang nangyayari on top of Philhealth reimbursement, nagbabayad pa ang pasyente ng out-of-pocket na mga 3,000. That's why our direction is just for the government, because we have the sin taxes, to provide these equipments to qualified government hospitals so that we won't be tied with public-private partnership, where on top of PhilHealth, there is an additional out-of-pocket cost. And this will again point to increasing HFEP allocation. Will the Honorable Secretary and the DOH family be amenable to this?
Yes, certainly,
Secretary Duque.
Madam Chair.
Thank you very much, Madam Chair. On the last 2 points of discussion, I heard earlier Congressman Remulla mentioned PhilHealth. Ang aking pong eksperyensya sa PhilHealth, doon po sa listahan ng miyembro, napakarami pong numero pero walang pangalan. Where in fact, the discussion on the 10.6 billion that was alleged to be realigned allegedly from PhilHealth to DOH was non-existent. And I believe Secretary Duque was with me in the board during the time. Ang nangyari po, nung pinipresent ng PhilHealth, ang kanilang datos, nung pinisent ng PhilHealth, ang kanilang membership at financials, ang daming hindi tugma. And when I look at the actual cash plus the investments, talagang hindi tugma. And when I asked the finance department, their answer was, Sec, ma'am, ganyan ang actual cash ng PhilHealth kasi ang daming utang ng gobyerno na hindi nababayaran. Siyempre, medyo uminit ako because as chairman of the board, I wanted to protect the members' money. We had 3 meetings with DBM. And when I was called to a confidential closed-door meeting, to the surprise of my life, I was informed, Ma'am, ang sinasabi nyo, 30 billion ang utang ng gobyerno. Sabi ko, yan ang report sa akin. Ito yung hinihingi ko kasi merong unprogrammed fund, yung 10.6. Sabi nila, Ma'am, ito yung CD. Listahan ng mga miyembro na sinabmit nyo sa amin para bayaran ng DBM. Ipapatakbuhin namin ito sa computer para makita nyo. To my surprise, all the names in my request for 10.6 billion release to PhilHealth were either duplicate names, people more than 100 years old, and worst, 80% of the people there were either spouses or dependents of existing members. Ano po ang nangyayari? Nagbibigay ang gobyerno ng malaking pondo para sa enrollment ng premium ng mga tao. But the impact that our government wants. Universal healthcare, yan ang sigaw ng taong bayan. Yan ang sigaw ng Kongreso at ng Senado. Pero kung yung pondo na binibigay ng gobyerno, papunta ng DBM at papunta ng Philhealth, pero yung ini-enroll natin ng mga tao ay either non-existent or existing members, my question to Secretary Duque, will this redound to additional members?
Secretary Duque.
Yes, thank you. If there are double counting or registration in the database of non-existing members after validation, that's why I think in the process the validation is extremely important. But you're right, I agree with you that a sloppy database will really tend to bloat the number of members.
Just to cite an example, Madam Chair, taking off from
Kong
Congressman...
Janet, madami pa pong nag-aantay.
Yes, ma'am. My last question and my last point. Yung pong binigay ang pondo, kunyari, senior citizens, ilalagay 8 million senior citizens. Pero ang may pangalan lang ay 3 milyon. Hindi po nagagamit ng maayos ang pondo na ginagamit natin para sa ating mga kababayan because there are no new members being enrolled. So my request, Madam Chair, is for the Honorable Secretary and the Honorable President to look into the actual names and database of members para naman mabigyan ng kasagutan ang tanong ni Congressman Remulla. Out of the 71 billion subsidy to new members or current members or those for enrollment, sino-sino yung mga ito? Wala ba itong duplication or meron ba? Sino naman dito yung binayaran via a point of care or a point of, what do you call the...
Service.
Point of service. Ibig sabihin, kapag ako'y pumunta sa ospital, wala ako sa listahan ng Philhealth, babayaran ako ng MAIP or babayaran ako ng ospital. So why will Philhealth charge my premium to DBM and to the 71 billion? My point, Madam Chair, is that, moving to my last question, ano ang gagawin natin sa sangkatutak na enrollees ng Philhealth? Kung yung atin namang mga ospital na panggobyerno hindi nabigyan ng sapat na pondo para sa kanilang infrastruktura at sa kanilang kagamitan. If I am a Philhealth member, how can I avail of my dialysis package or my cancer package or my cabbage or heart ailment package kung wala namang kagamitan, hindi ma-accredit at hindi mabigyan ng sapat na kakayahan yung mga ospital because you gave the Health Facilities Enhancement Program a measly 4.7 billion budget. Ang tanong ko, matitimbang ba natin, will you agree with us in saying that Philhealth membership will be maximized if we equipped our LGU hospitals, our DOH hospitals with enough funds so that they will be Philhealth accredited, they will be upgraded, and they will not be downgraded. Your comments on that, please, Madam Chair, Secretary, and the Honorable DOH family.
Secretary Duque.
Madam Chair, I agree with the observation of Congresswoman Garin, and it is crucial that the capacity of the national government hospitals, even the local government hospitals, must be expanded precisely to match the demands that will come about with the increasing membership or universal health insurance coverage of Filipinos. And so it is for that reason that I have written to Speaker Alan Cayetano for an augmentation over and above the 4.7 billion that is reflected in the National Expenditure Plan. We have asked for 10 billion more for infrastructure, additional equipment, and transport, medical transport vehicles. And this has been submitted to the office of the speaker, the deputy speakers, and the committee on finance secretariat today, Your Honor.
Thank you very much, Honorable Chairman. Thank you
Thank
very
you.
much, Secretary Duque.
Thank you, Kong Janet. The next one to interpolate is Representative Abdullah Dimaporo. Now you are recognized.
Madam Chairperson, can you hear me?
Opo.
Okay, thank you, Madam Chairperson. I just have two questions, but with the manifestations, my two questions can be answered after my manifestation, Madam Chairperson. Madam Chairperson, I was glad when the good secretary was appointed as DOH secretary, and I thought that he would be helping our province. But not one of my requests to meet him was accepted. And I am surprised that the 2019 GAA has 3 mobile dental vans for Lanao del Norte, 2 for the Kapatagan Provincial Hospital, and 1 for the Sultan Aga Dimapuro Provincial Hospital. And it's been more than 1 year. We have not seen these vans yet. Where are these? Second, DOH informed us in writing that in the 2020 GAA, we have 3 million pesos for a health station. When will DOH implement this, as it is almost the end of 2020? We have only one PCR testing laboratory, which needs more equipments, and we need to complement it with proper isolation facilities in 5 priority areas. We thank DOH for its technical assistance, but what we need more is its financial assistance in form of necessary equipments. The barangay health stations in our interior municipalities need equipments from DOH, especially during this time of COVID-19. The inhabitants of these are Muslims who supported the complaint of the MNLF that they are being neglected by our national government. So that ends my questions and manifestation, Madam Chairperson. I need the answer to my questions. Where are the 3 mobile dental vans and will the health station be implemented by DOH?
Madam Chair, with your permission, Madam Chair, Madam Chair, Madam Chair, would like to ask that Director Gorgolon be recognized, Madam Chair. Thank you.
Yusek Villaverde, you are now recognized. Director Gorgulon, you are now recognized.
Good afternoon, Madam Chair, and to the honorable members of this august body and its family. As far as the mobile dental van po, it's now on the procurement stage. In fact, for 2019, na-award na po, so we're just awaiting delivery for the dental van. And for the BHS and the facility that you are requesting, we will review our list, but we will consider your request. Thank you very much. Good afternoon.
Thank you, Madam Chairperson. Thank you very much. I am just worried because I am also a Muslim.
DOH. Kong Abdul, pwede po pakiulit yung question?
Nasagot na po. Nasagot na.
Madam Chair, natapos na po yung katanungan.
Congressman Abdul de Maporod, tapos na po.
Yes, tapos na po. Thank you, Madam Chairperson.
Thank you po, thank you. The next one to interpolate is Congressman Carlos Zarate. The next one is Vice Chair Paul Dasa. You are now recognized.
Madam Chair, thank you very much.
Madam Chair.
Madam Chair, I just heard Kong Zarate. I will yield if he's already ready.
Madam Chair.
Kong Paul.
Madam Chair, I think the previous to me is, I just heard is on now, Kong Zarate. Would you recognize me or him?
Kong Paul, kayo po muna.
Okay, thank you. Administrative lang, Madam Chair. Congressman Junong had said he registered and was giving me his 3 minutes. Could you please confirm that with the ComSec?
Hello. Yes, yes.
DOH.
Yes, yes.
Madam Chair, I think Congressman Paul Dasa was asking for a confirmation of whether Congressman Ong has indeed given him his 3 minutes to Congressman Dasa.
Wala pa naman pong abiso dito na he will give you the 3 minutes, Kong Paul.
Yeah, I just talked to him 10 minutes ago. Anyway, maybe if we can ask the ComSec to just call and confirm while I now start my interpellation. Thank you, Madam Chair. Madam Chair, in February 14, 2019, the President and Congress gave a Valentine's gift to cancer patients in this country by passing RA 11215. I'd like to get information on, has the DBM or DOH funded any of the requirements of the Philippine cancer law that we should be implementing already this year?
Kong Paul, before I recognize DOH, I just want you to know that Kong Ong is not listed in the interpellators. Kaya wala po siya dito, kaya hindi siya nakalista, so I cannot give you the 3 minutes. Thank you. Now, Secretary Duque.
Yeah, may I ask that Yusek Mirna Kabutahe be recognized?
Thank you, Madam Chair. Thank you, Mr. Congressman. In terms of the National Integrated Cancer Control Act, we have proposed increased budget, but it was not allowed for Tier 2. But for 2020, our NCD line item budget has an appropriation for cancer of 157 million for the cancer drugs and 5 million under the public health management. This is for technical assistance, training, and so on. Under the Philippine Integrated Cancer Control Act, we have proposed the creation of a cancer division, which is pending with the Department of Budget and Management. We have started to develop the Philippine Cancer Center, which is now being developed under a structure, because instead of initially the intention was to have our cancer centers, several cancer centers, but we are now trying to integrate them into a one Philippine Cancer Cancer Center.
Madam Chair, the Cancer Center, I believe, is in the Lung Center, the Philippines, in QC. When can we get that finished?
For the Philippine Cancer Center, Your Honor, we have an additional personnel, but they are job order. They were hired in August 2019, pending the Cancer Control Division, with plantilla position based on approved NOSCA from DBM. We're supposed to develop a cancer care infrastructure and the establishment of the Philippine Cancer Center and development of standards for cancer care centers and regional cancer care centers. These are in the pipeline according to the health facilities development structure, Your Honor.
So can we get that going by year end? Can we get your commitment? By end of the year?
For the strategic plan, Your Honor, we will be ready, but for the plantilla positions, it will be dependent on may NOSCA na? There's already a NOSCA, and we will already start hiring for the cancer division.
Okay. Madam Chair, one of the requirements of the cancer law was the creation of the National Integrated Cancer Control Council. The President appoints 5 members of the council. That doesn't need any funds. May I ask the Secretary if we can get a commitment to get the appointments out, so at least we can now start with the Cancer Control Council, which doesn't require any funding.
Madam Chair, may I answer?
Yes.
In terms of the National Integrated Cancer Control Council, we have already 2 appointments that were issued by the Office of the President in May of 2020. This is Dr. Samuel Ang and Dr. May Dolendo. The appointment of 3 non-ex officio members are still pending approval. The other agencies involved in the Cancer Control Council, aside from DOH, include the DSWD, the DOLE, the DILG, the PHIC, and the Food and Drug Administration.
So my question is, when can you get them appointed? You don't need any funds for that. You just have to follow up the appointment. It's a short answer.
Madam Chair, we have been following up with the Office of the President through USEC Jennifer Ong, the appointments of the remaining members to the council. So we'll follow up again, Your Honors.
Thank you, Madam Chair. My question to Philhealth or DOH, we're all bothered about the Philhealth fraud issues, but I think we need to differentiate on fraud regarding private facilities and government facilities. When I was governor, Madam Chair, I remember getting some information before that most of the fraud, if there are any, is in the private facilities, but not in the government hospitals. Is that a fair statement, Mr. Secretary?
I would like, with the permission of the chair, for SVP Neri to respond to that query.
As Mr. Chair, Mr. Congressman, I think you're correct po. There is more fraud in the private facilities than in the government.
Okay, and that's because the reimbursement received in the government hospitals don't go to individuals, it goes back into the treasury of the LGU or the general funds of the GOCC. Now, I'm also bothered about the IRM. It's just a yes or no. Am I correct that there was precedence for the IRM? When Yolanda hit Region 8, IRM was used for Region 8 hospitals. The Marawi siege in armed IRM was done. And also for the Taal volcano, Region 4B, we advanced funds to hospitals to help them cater to victims and for emergencies connected with those calamities. Is that correct, Madam Chair?
That is correct, Your Honors, that indeed IRM is not new, and this has been implemented uh, and given to hospitals that have been severely affected by calamitous events.
My concern, Madam Chair, is I had found out that because of the issues on the IRM, that almost half of the government hospitals were not given the IRM because it was put on hold. So my request to President Giran and Secretary Duque is to consider the harm it will do by not giving these funds to the government hospitals, who to begin with may not have any fraud, and if they do, very limited fraud. Can I get a reaction to the President of Philhealth and the Secretary?
Yes, thank you, Madam Chair. The IRM has been suspended by the board, I think, last month, about the end of August, pending the resolution of the following issues. Number one, the legal basis. This was asked by the Committee of the Whole of Senate, and also the issue of withholding tax, failure to withhold taxes on the reimbursements or on the IRMs. And then number three is uh, the alleged palakasan system in the distribution of the IRM. And I think the other one is, I forget, the other withholding tax, legal basis, and the liquidation of the IRMs that have been disbursed to the 711 hospitals, if I am if I recall. But I would like also to state for the record that the resolution authorizing the implementation of the IRM, I was absent and I did not sign the said resolution as I was chairing the Interagency Task Force on Emerging Infectious Disease and leading the national government in the COVID-19 pandemic response. And it is for this reason that I had delegated the chairmanship of the PhilHealth board meetings to then President and CEO, uh, who by law must assume the chairmanship in the absence of the regular chair, ex officio chair, which happens to be the DOH secretary. So, yun lang po, the sinuspend, but suffice it to say that the benefits are continuing and that PhilHealth continues to pay reimbursements to the providers of healthcare services using the normal route, which is the filing of claims before the regional PhilHealth offices, and they are given 60 days within which to file, and PhilHealth is trying its best to improve its turnaround time in terms of the benefit payments to said hospitals.
Okay, Madam Chair, I'm happy to hear that. I have two short manifestations, Madam Chair, and I will wrap up. I'm just worried if PhilHealth's listening, and Secretary, I appreciate that. I'm very concerned about the LGU hospitals because they do need the funds for their operations. And then my request, Madam Chair, the so-called case rates of PhilHealth was done 8 years ago. This needs to be revisited, and I hope that they will do something about the case rates to help increase the benefits to our facilities. And last, Madam Chair, I was unable to attend certain hearings because I wasn't feeling well. But my district, a private hospital in my district was alluded to that it received funds even though it wasn't supposed to on the IRM. For the record, and I hope many of the members are here, uh, were also there in those particular committee hearings. A private hospital called Katarman Doctors Hospital did not illegally receive funds from Philhealth. First, it received its funds in April 2020. Their suspension ended sometime in March. Secondly, Katarman Doctors Hospital is the only private hospital in the capital town. They filed their accreditation with Philhealth in December 2019. The last thing that I would like to see is for a private hospital to close down and to put additional burden to the LGU hospitals. So I wanted that on the record. I wanted Philhealth and DOH to hear that because I'm sure there are many other similar areas where the private facilities are demoralized, and we need to consider that these doctors and nurses and other providers, the last thing we want is for them to close, especially when we don't have enough government beds to serve, especially the poor areas. So thank you, Madam Chair, for the time. I yield back to our chair.
Thank you very much, Congressman Daza. The next to interpolate, the chair recognizes Congressman Mike Defensor.
Thank you, Mr. Chair. Thank you, Madam Chair. Mr. Secretary, magandang hapon po sa inyo sa
Good
DOH
afternoon,
family.
Your Honor.
Yes. I just wanted to ask Madam Chair, the last time, yung pong pag-uusap namin tungkol po sa HFEP. Mr. Secretary, nag-usap po kami nila Yusek David, Director Gorgolon regarding dito, at maging ang Speaker Alan Cayetano po nagsalita na yung nga po nabanggit niya, sa gitna ng pinagdaanan nating pandemya nitong COVID, siguro naman po hindi dapat business as usual at kailangan itama po natin yung pondo natin sa HFEP. Kalinsinod po dito, syempre, palakasin yung ating mga ospital, palakasin yung mga district hospitals. Naintindihan ko, Mr. Secretary, yung binabanggit po ninyo dito sa primary care facility. Pero ito naman po, sa aking pananaw, pwede nang gampanan ng local government kung ito po'y 100,000, 200,000, kaya naman po ito ng mismong mga barangay. Pero siyempre ho, yung pagpapalakas ng pasilidades ng ating mga hospital, district hospitals, hindi na po nila kaya yung pondong paggagamitan dito. So with that, Mr. Secretary, may I ask Director Gorgolon or Yusek David, kung ano na po ba yung naging pagsasaayos dito sa pondo ng Health Facilities Enhancement Program.
Madam Chair, seeking your permission to recognize Yusek David.
Yusek David, you are now recognized.
Maraming salamat po, Madam Chair and Kong Defensor. So, ganun na po na ang Department of Health po ay sumulat po sa Speaker po of the House para po madagdagan po sana yung budget natin ng HFEP for 10 billion. At maliban po doon, nakausap na ho namin ang aming regional director tungkol sa mga priorities na dapat gawin at pagkukonsulta din po para sa ano yung kailangan na i-program natin sa ating HFEP for 2021.
So
Salamat po.
Ano pong ibig sabihin nun na Yusek David? Kunyari po, isang example lang po, no, Cagayan, nandito po sa akin, 100,000 po to sa iba't ibang munisipyo ng Cagayan. So ito po ba ibabaguhin? The total is 37 municipalities na tiga 100,000. Na kung katulad po ng kumamarapatin yun na pag-usapan natin, kung ito'y ilalagay sa isang district hospital or isang rural health unit, ay mas makakatulong. Nandito po si Attorney Gran ng Philhealth. Katulad po nung nabanggit ko, di ba ang ginawa ng ating Pangulo, pinalakas po yung Philhealth, dinagdagan ng pondo, para sa ganon, kung ikay magpupunta sa ospital, may sapat kang suporta. At kalinsunod dito, nilabas naman yung Health Facilities Enhancement Program para palakas naman din po yung public hospitals po natin. Magkarungtog po yun eh. And so, Yusek David, so batay po dun sa nabanggitin nyo, will there be changes to this doon po sa coordination nyo with the regional officers of Department of Health?
Yes, Madam Chair, Kong Defense. So, ang ating mga regional offices po ay kakausapin ho ating mga local government units for priorities. Ang isa ho nila sigurong tatalakayin ay itong barangay health stations. Kung kaya nga po ng local government unit na punuin na lang po yung pambayad sa equipment sa BHS, yaman din lang po na 170,000 ito. Siguro po maglalagay tayo ng exceptions para sa mga local government units na mababa ho ang income at kailangan ho talaga nila ng tulong.
Yes, well, Yusek David, another thing po, nakita po natin dito sa COVID, isa sa mga problema natin yung mga testing. And during our discussion, binanggit ko po sa inyo din ito, yung mobile laboratories under the Health Facilities Enhancement Program. Bakit to? Katulad po nung nakita natin itong dumang pandemya, kung meron po tayong mobile laboratories, kahit papano, sila mismo makaikot sa isang lugar para magkaroon ng mga testing yung ating mga kababayan. Is that possible under the Health Facilities Enhancement Program?
Meron naman, Madam Chair, Kong Defensor, meron naman po tayong sa ating line item po, meron din ho naman tayong mobile transport. So, i-consider po natin yon, yung ating mobile laboratories.
Thank you. Last but not the least, Madam Chair, for Attorney Geran. Attorney Geran, yung palang Philhealth, nagkaroon pala ng proposal ang Land Bank for a computerization end-to-end at no cost to the government. I'm not sure if you are aware of that, pero ito po'y isang programa na maring tingnan ng Philhealth. Kasi nung tinanong ko po, bakit pala ang Land Bank ay mag-o-offer ng no cost to the government? Kasi po pala, 95% ng inyong pondo ay nasa loob ng Land Bank. So, would you be amenable in pursuing yung pong programa ng computerization under Philhealth with Land Bank at no cost to Philhealth?
Attorney Giran, you are now recognized.
Good afternoon, Madam Chair, and the very good Congressman Mike. Of course, IT will be one of my programs to avert the possibility of future fraud. It will help, of course. Sometimes we cannot avoid because IT is being manned by a person. And with respect to Land Bank, it's very good at no cost. However, in one of our board meetings, Sunny Dominguez also offered the facility or the talent of the Union Bank. Now, for me, it's irrelevant. It's nowhere or there. As long as I have the IT, it's kahit sino po, basta may IT po ako.
Wala pong problema, Attorney Geran, kung ito po'y Land Bank or Union Bank. Ang maganda lang po naman sa Land Bank is it is government. Kaya medyo mas makakaiwas kayo sa mahabang proseso ng pagsasaayos. And last but not the least, thank you, Attorney Geran, for that. Last but not the least, again, I'd like to ask the Department of Health, yung pong naging medicines na nag-expire, have we filed a case? Because under the law, sa ilalim po ng ating batas, ito po talaga merong liability. I asked this the last time during the discussion, Secretary Duque. I think I asked admin to answer on this. Secretary Duque, the reason why tinuturo ko po ang admin dito, kasi it should be initially an admin case. If there is, may mga expired medicines po tayo, 30 million, recorded po yun under COA, dapat naman po makasuhan kung sino man yung involved dito sa pagpapabaya na nagkaroon ng expiration ng ating gamot.
Secretary Duque.
Yes, thank you, Madam Chair. I would like to invite the Chair to please recognize ASEC Sheree Grande, who is in the Zoom, I understand. ASEC Sheree Grande, to please.
Good afternoon, sir. Good afternoon, sir. Good afternoon, Madam Chair, Congressman. Yes po, sir. We have already issued SHOCOS orders po to different hospitals po, sir, na nakitaan po ng aming internal audit po, sir, ng mga expiration po ng mga gamot at kaya yung mga hindi po nagamit na mga equipment po. Over.
Maraming po salamat, Madam Chair, Secretary Duque. Pagpasensyahan nyo naman po na medyo nakatuto kami ng husto sa Philhealth, sa Department of Health, sa kadailanan din naman po na nakita natin yung naging problema ng pandemya. And we would like to assure you na hindi naman po kami para ihinto o guluhin ang budget ng DOH. Ang gusto po namin makatulong, maalalayan din po ang departamento, at syempre sa pangkalahatan, yung ating po mga kababayan. And so, doon po sa HFEP, Secretary Duque, with your indulgence, sila Yusek David, Director Gorgolon, titingnan pa rin po namin ano yung final program ninyo. Kasi ang pondo po natin, 20 billion each year. At ang gusto po natin mapalakas talaga, ang programang pangkalusugan ng mga ospital natin, district hospitals, siguro minimum, our rural health units. As far as yung mga pangangailangan sa primary healthcare, kami po, committed kami na ayusin yung pondo ng local governments under the local government code na kung yung edukasyon merong specific allotment, kailangan na rin po magkaroon ng specific allotment para naman po sa pangkalusugan. Para hindi lahat ay nakapasok o yung bang kinakarga ng Department of Health ang problema. Siguro at some level sa kanila at on the national level, Department of Health, meron din po tayong pagtulong sa mga provincial, district, and rural health units. So with that, Madam Chair, thank you for the opportunity, and of course, we will always support the Department of Health budget. Maraming salamat po.
Thank you, Kong Mike.
Professor.
Thank you,
The
Madam
next
Chair.
one to interpolate is Representative Mark Go. Representative Mark Go.
Tawag ka na po ng iba.
The next one to interpolate is Representative Vicente Veloso.
Thank you, Madam Chair. I'll make myself very brief in my interpellation. First of all, salamat Secretary Duque sa trabaho mo. Sana hindi ka muna malis dyan, Secretary. But I'll go direct to the point. Alam mo itong Eastern Visayas Regional Medical Center na talagang hirap na hirap. And for that reason, nagkaroon na tayo ng extension in my district sa Villaba. Until now, after a delay in the construction of 1 year, and after its inauguration last January, until now, hindi pa po ito nag-ooperate. Ano po kaya magagawa natin dito, Mr. Secretary?
Thank you, Congressman Veloso. Madam Chair, may I ask Director Gorgolon or Yusek David to please respond to the question.
Yusek David, you are now recognized.
Magandang hapon uli, Madam Chair and Kong Veloso. Sir, with regards Villaba Polyclinic, again, we will coordinate with Eastern Visayas Medical Center. They had already committed some health workers to operationalize the Villaba Polyclinic. And even the U.S. Central Office has committed some amount for the MOE. So we will just follow up this operationalization. Yes, we visited the area po and we are supporting this. Thank you very much.
Thank you for that, Madam Chair. Next question is, dito sa proposed budget, the DOH will be deploying 23,364 HRH, meaning yung mga doctors, nurses, midwives, etc. Kulang tayo ng health workers for EVRMC Villaba. Naisama po ba ito sa budget ninyo for 2021? Deployment of HRH workers.
Yusek Villaverde, may I ask the Chair's permission to recognize Yusek Villaverde?
Um, Thank you, Madam Chair, Congressman Veloso. Yung deployment program po is actually, ito yung Doctors to the Barrios at yung Nurse Deployment Program na nasa community level, primary care facilities. So kung ito po ay extension ng hospital, dapat po ay i-propose ito na plantilla position mismo ng hospital. And I think with some of our items remaining unfilled, pwede naman po siguro na lagyan ito ng ating Eastern Visayas Medical Center ng position para mag-operate na yung inyong extension hospital. No? So titingnan po natin ito and we will coordinate with the regional director and the medical center chief para malagyan na ng mga item itong inyong extension hospital.
Next question, this will be my last two questions, Madam Chair. Dito sa procurement of health equipment and health facilities, the proposed budget speaks of 4.68 billion pesos. Kasama rin po ba ang Bunyaba EVRMC Polyclinic? Because alam naman na po natin na without this hospital equipment and facilities, wala tayong magagawa doon sa hospital na yan. Kasama po ba ang EVRMC, Bunyaba Polyclinic, Madam Chair?
Director Guruglan o
Madam Chair, yes, yes, Kong, kasama po siya sa proposed 2021, but we will also reconsider the amount. Thank you very much.
Itong last question ko na lang po. I have been comparing sa mga Visayas regional hospitals. Barangay Health, binigyan ang Region 6 ng 10 million plus, almost 11 million, Region 7, 0, Region 8, 0. Ang Region 7 okay lang because it's the richest region in Visayas. But ang Region 8 is the second poorest region in the Philippines. Bakit tayo magbibigay ng 0 for barangay health worker?
DOH.
Madam Chair, hindi po namin nakuha yung barangay, ano po yun?
Kong Ching, pakiulit po ang tanong.
I asked my staff to tabulate the funding for regions 6, 7, and 8, particularly doon sa mga barangay health facilities. And Region 8 got a 0 funding. Totoo po ba ito? Even Region 8 is the second poorest region in the Philippines. Leyte Samar area. Bakit 0 ang funding natin sa barangay health facility workers or facilities?
Director Gorgolan.
Yes, sir. Actually, we are now reviewing the list because maybe the request from your end, I'm not sure yet, it is mostly infrastructure, wherein we don't have funding. So we are now reviewing the list po and we will update you. We will submit report. Thank you very much.
Thank you for that. At sana kare-retire lang o mag-retire na yung regional director namin sa Region 8. Sana Secretary Duque, isa ko sa supporter mo. Sana i-assign mo ito si Director Gorgolon doon sa Region 8. Maraming salamat po.
Thank you, Kong Ching Biloso. The next one to interpolate is Representative Eric Martinez. Kong Eric Martinez. The next one is Representative Florida Robes. Representative Florida Robes. The next one is Representative Mark Go. Representative Mark Go. The next one is Representative Virgilio Lacson. Representative Virgilio Lacson. And the next one to interpolate is Vice Chair Mikey Arroyo. Representative Bernadette Herrera. Representative Bernadette Herrera. And the next one to interpolate is Vice Chair Luisa Quaresma. Vice Chair Luisa Quaresma. The next one to interpolate is Representative Tyron Agabas.
Madam Chair.
Ito na,
Hello?
Manang Luisa.
Yes.
Manang Luisa.
I will read.
Kung si Manang Luisa.
Yes, si Manang muna.
Manang Luisa, Congresswoman Luisa Quaresma, you are now recognized.
Yes, thank you very much, Madam Chairman. And good afternoon to the family. Now, Madam Chairman, my first question is as usual about the Philhealth assistance to our dialysis patients. In fact, that was my question again before. Kasi usually ang binibigay ng Philhealth in the previous was only 9 dialysis session. 90, I mean, for a year. Pero I think now, may I ask from the Secretary as to how many dialysis, ilan na hong sessions ang binibigay ng Philhealth. The second question that I will ask the Secretary, Madam Chairman, is about the construction of health centers. Pwede po ba, mahal naming Secretary, na pagsabihan naman yung mga contractors ng inyong mga barangay health stations? Dahil po, kami naman pong mga representative na mga tao dyan sa national level, kami naman po yung nasisira or sa amin pinapakasalanan. Dahil po dito sa amin po, may mga barangay health stations na hindi ho maganda ang pagkagawa. Kaya my appeal to the Secretary is to also instruct and monitor the construction of barangay health stations. Going back to the Philhealth, Madam Chairman, yun nga, hindi po ba unlimited yung binibigay natin sa mga dialysis, sa mga pasyenteng nagda-dialysis? It should be unlimited na po because you see, there are at times patients who are undergoing 3 times a week dialysis session. Yun ang binibigay ng Philhealth na kulang. Alam naman natin na sa ngayon, ang dami palang anomalya dyan. So, please give priority and give more support to our dialysis patients. Yun lang po, Madam Chairman, and may I get an answer from the Secretary?
Thank you, Madam Chair. Thank you, Congressman Quaresma. Whatever is in excess of the 90 sessions for dialysis that your patients access will already be for the account of Philhealth. So this is under the state of public health emergency which the President has extended. So wala pong problema dahil yan po ay babayaran naman ng Philhealth. Walang de facto, walang limit. So sabihan lang po kami kung may mga facilities na lumalabag doon po sa atin na patakaran. Yung pong sinasabi ninyo kung about the barangay health stations, Ito po ay amin pong pabibisitahin sa amin regional office at alamin kung ano ang kanilang mga karagdagan pangangailangan at dito po sa hinihingi po natin na karagdagan budget ay maisasama po natin ang mga ah, pangangailangan para makapagbigay po sila ng maayos na primary care services.
Madam Chair, may I be recognized again? So in other words, Mr. Secretary, unlimited na yung dialysis, pag-dialysis ng ating mga pasyente. Unlimited na, kumbaga. So, anyway, I'll just get in touch with your office kung nagkaroon tayo ng problema. As you've said, ipapaabot ko po kung nagkaroon tayo ng problema. With the barangay health stations naman, I'm so grateful, Mr. Secretary, na at least you will instruct your regional director. Of course, we have the regional director Rio here na masipag naman. And I admire him dahil talagang grabe yung support niya ngayon dito. Particularly now that with a population of like 500,000 persons. Kami ngayon, umabot kami ng 300 plus, but now we are so grateful na 200 plus na lang yung active positive sa amin dito. And I also would like to take this opportunity, Madam Chair, to thank Secretary Duque, the Department of Health in particular. Siyempre, of course, Secretary Mercado Grande, who all the way, the DOH supported us all the way hanggang sa mass testing and everything here in in the province of Nueva Vizcaya. Thank you, Mr. Secretary, and thank you, Madam Chair.
Salamat po. Madam Chair, I just
No
want to
problem with my
clarify.
video.
Madam Chair, let me just clarify my earlier statement that although it is correct to say that the dialysis sessions have been allowed to proceed until beyond the 90 sessions, no, until December 19, in the context of the approval of the Bayanihan Act 2 passed by Congress and signed by the President.
Thank you. The next one to interpolate is Representative Dagook.
Mr. Chairman.
Kung
Madam Chairman.
agabas, kasi
Yes.
po pagkatapos ng majority, mayroon po tayong minority.
I will lead to that, Madam Chairman.
Kaya Representative Dagook, you are now recognized.
Thank you, Madam Chair. Good afternoon, everyone, especially to the DOH family. I want to be specific, Madam Chair. Gusto ko lang itanong, ano po ba yung mga medical facilities na i-construct or gagawin, no? Or that will be implemented for 2021 in Siargao and Dinagat Islands, if there is any, Madam Chair, Mr. Secretary.
With the permission of the Chair,
DOH.
please recognize Director Gorgolon.
Madam Chair,
Yes, Director.
Congressman Dagook. Yes, sir, we will submit the list specific for the province of Siargao and Dinagat as to the list for the BHS, RHUs, and LGU hospital. We will submit the list, sir. Thank you very much.
Yun lang po. But definitely, mayroon po siya. Mayroon po, may kababayan, Asik Gorgolon. Mayroon po talaga.
Yes, sir, meron po. Thank you.
Okay, yun lang po, Madam Chair. Maraming salamat po, Secretary Asik Gorgolon.
Salamat din po, Kong.
Thank you po, Congressman Dagook. And the next one to interpolate po is Representative Mark Go. Kung agabas, nauna po sa listahan si Representative Mark Go.
Okay.
Representative Mark Go, you are now recognized.
Thank you very much, Madam Chair. Magandang hapon po sa lahat ng nandyan sa plenary hall ng Congress. Of course, kasama rin po dyan si Secretary Duque at yung kanyang team ng Department of Health. Unang-una po, gusto ko munang magpasalamat sa Department of Health at saka kay Secretary Duque at yung kanyang mga ibang USEC na tumulong po dito sa lungsod ng Baguio, lalong-lalo na po nung in-implement natin po yung naipasang batas para ma-increase yung bed capacity ng Baguio General Hospital from 500 to 800 beds. We are on our way to complete yung program na yan. Ako po yung author ng bill na yan. Pangalawa po, gusto ko rin pasalamatan ang DOH sa tulong po ng regional office dito po. Nung si acting director, si Dr. Pangilinan, tungkol po sa pag-address namin sa mga COVID-19 problems namin dito sa lungsod ng Baguio. Napakalaki po ang tulong na ibinigay ng ating pong Department of Health. Pangatlo po, yung pong isa pang gusto kong pasalamatan, yung pong pagbibigay ng tulong ng medical assistance sa ating pong mga pasyente dito sa lungsod ng Baguio. Marami pong naitulong ang Department of Health dito. Kaya marami pong salamat, Mr. Secretary, at yung pong inyong team sa inyong patuloy na pagtulong sa ating pong mga kababayan dito po sa lungsod ng Baguio. Ito po, ang gusto kong tanungin ay ang Philhealth. Gusto kong malaman po dahil po sa naipasa naming batas, yung pong Universal Healthcare Law, ito po ay malaking gastusin para sa gobyerno. Hindi po kasalanan ng DOH kung bakit sila naglagay ng malaking pondo para po sa Philhealth Insurance Corporation amounting to about 71 billion pesos for 2021. Ang dahilan po dito ay dahil po doon sa batas na ipinasa namin sa Kongreso. Ngayon po, gusto kong malaman ilang pong porsyento out of this budget ang indirect contributors, yung pong binabayaran ng gobyerno na binigyan natin ng PhilHealth coverage as against those that are direct contributors. Ito po yung mga nagtatrabaho at nagbabayad ng premium monthly.
SVP Nery Santiago, you are now recognized.
Yes, Madam Chair. Thank you, Congressman. Yun ang tanong ko po, ang katanungan po is ilang porsyento po ang indirect contributor beneficiaries compared to the direct contributors? Yun po ba yung tanong?
Yes, ma'am.
Okay. Pagdating po sa beneficiaries, nasa ang nasa indirect po is nasa mga 56% po ang nasa indirect na beneficiaries po out of the 110 million na ating populasyon.
Yung pong nakalagay dito sa performance and targets na presentation po ni Secretary Duque, nakalagay po rito yung 2019 accomplishment out of 108 million Filipinos na covered ng PhilHealth, kino-cover nyo po yung 100% dito. That means everybody. Yung pong 108 na yan, million, so 56% po dyan ay mga indirect contributors. Magkano po ang charge ng bawat isa? Magkano ang charge ng PhilHealth bawat isa na binabayaran po ng ating gobyerno?
Sa ngayon po, yung pong 71 billion, Madam Chair, na pondo na binibigay po ng gobyerno, ang charge po sa ngayon ay hindi po tumaas, nasa 2,400 pa rin po para dun sa non-senior citizens and 5,000 po para sa senior citizens. Madam
Ngayon
Chair.
po, yung pong Mr. Chair, Madam Chair, yung pong
Congressman
number
Mark Go, last question na po.
Opo, yung pong 56% na 108, hindi po 56% yung 108. Kasi po dyan, marami pong mga dependents ng mga paying or non-paying beneficiaries So hindi po dapat i-multiply yung amount na nabanggit nyo kanina per person, kundi yun lang pong mga nagdapat bayaran ng gobyerno at hindi po kasama yung mga dependents ng mga beneficiaries, hindi po ba?
Madam Chair, tama po. Yung pong sinabi kong numero ay kasama po ang dependents doon. Para po dun sa number of payers lang po, nasa 21 million po ang payers po out of the, yun pong nagbabayad lang.
Dito po sa budget ninyo ng 2021, hindi po nagbago ang budget. 71 billion pa rin. Tama po ba yun?
Tama po, Madam Chair.
Yung pong payment po ninyo sa mga beneficiaries, yung pong payment sa mga ospital, no, kung saan na ospital itong mga pasyente natin, magkano po yung total na binayad ninyo?
Para po sa buong binayad po namin ng 2019 sa benefits ay mga 136 billion po.
126 billion.
136
so,
po.
36. So yung pong diferensya niyan, more than 60 billion o 50 billion plus, yun po ay galing sa binayad ng mga direct contributors. Tama po ba yun?
Tama po. Bali, pagdating po sa pagbinayad, ang collection po namin ng 2019 ay 146 billion. Kaya po yung difference. Yes, sir.
So, sobra-sobra po dapat ang pondo nyo kasi 146 plus 71 billion,
ay kasama na po,
more than 200 billion.
Sorry, Madam Chair. Ang 146 po, kasama na po yung 71 billion doon.
Kasama na po yun.
Opo.
So, meron po kayong sobra, kumbaga. Tama po ba yun?
Meron pong kaunting sobra na mga... Yes po, doon po sa binayad namin na 136, ang natanggap po namin ay 146.
So, meron kayong mga 10 bilyon. Tama po ba yun?
Tama po.
Okay, I think my time is up. Kung meron pong second round na ako po'y magtatanong. Pero again, I would like to repeat my appreciation to the Department of Health for their continuing support to our district or hospital in the city of Baguio, and I would come back again for the second round if I will be given the chance, Madam Chair. Thank you very much.
Thank you, Kong Marco. And the next one to interpret is Representative Tyron Agabas. You are now recognized.
Thank you, Madam Chairman. Good afternoon, Masanders ng Aram, Honorable Secretary Francisco Duque, the Prime.
Good afternoon, Kong.
Yusek Mirna Kabutahe, and of course, Yusek Roger Tungan, Yusek Neri, and the men and women of the DOH family. I have lots of concerns with the DOH, but for now, I will limit my concern to barangay health stations and medical equipment of barangay health stations. This is a parochial concern which I believe is equally relevant to other congressional districts on similar footing. Mr. Secretary, on several occasions, I have written your office through Director Gorgolan for BHS, medical equipment, and other hospital-based facilities. Pero dito po sa aking distrito sa 2020, zero ang aking medical equipment, zero din ang BHS dahil wala raw pundo sa infra, zero din ang motor vehicles. But I believe itong mga request po nito were endorsed by our Regional Director Val Lopez. And this year, wala lang namang BHS dahil wala daw ulit pondo sa infra. Do I understand that there is a 5.5 billion anong program amount as per DBM Director de la Vega? In fairness sa DOH, Mr. Secretary, natuwa naman po ako dahil may 3 BHS na binigyan ng medical equipment sa 2021 fiscal year at 200,000 each. 3 po ito kaya 600,000, Mr. Secretary. Kahit maliit po ito, natutuwa na rin ang mga barangay officials at BHW sa aking distrito. Pero nagulat ako, Mr. Secretary, para sa aking distrito, na makita ko ang malalaking BHS medical equipment allocation ng ibang probinsya at distrito. Pero may ibang distrito kasi na zero, kagaya ng Mountain Province. At sa probinsya ng Pangasinan, may mga distrito din po na zero. Napakalaki po ang disparity, Mr. Secretary. Bakit po napakadami ang isang distrito at iba naman ay zero? Bakit po ganon? But please do not misunderstand me. Ako po ay natutuwa sa malalaking budget ng ibang distrito dahil kailangan din nila ang mga medical equipment. Pero bakit kailangan may ma-zero distrito sa BHS medical equipment? I cannot help myself comparing district allocations because all of us have equal, valid, and similar concerns, especially when our respective constituents start comparing district budgets as if we are doing nothing when we get less. I think there is a problem on BHS medical equipment prioritization protocols. Mr. Secretary, may I be enlightened as to how you identify and prioritize medical equipment to barangay stations in the countryside? Can I have an answer to that, Mr. Secretary?
Secretary Duque.
Yes, thank you very much, Madam Chair. We will review the allocation of the BHS medical equipment. I would like to refer the matter to Director Gorgolon to give a clearer explanation to the query of Congressman Agabas, with the permission of the chair.
Permission, Madam Chair. Yes, Congressman Agabas, we are now looking into and reviewing the list. And we are now coordinating with the regional office to revisit the listing, but we will consider you as a priority. Nakita naman po namin na hindi nabigyan yung distrito mo, but basically, from the request that we received, mostly it was infrastructure. And given that there was no allocation for infrastructure, but with the request of the augmentation, we will consider po, kasi nakita namin na GDA po kayo. Thank you very much.
If I may add, Madam Chair, Congressman Agabas, we have filed with the Speaker's office the request for an augmentation of about 10 billion pesos to cover civil works or infrastructure at about 7 billion thereabouts, and for additional equipment and medical transport vehicles on top of the 4.7 billion that has been reflected in the National Expenditure Plan as approved by the DBM. So we will we reassure you of a prompt review of the allocation. Thank you, Madam Chair.
Thank you, Mr. Secretary. Kasi on that note, in the 60th District of Pangasinan, we have 37.
Kong Tyron, last
yes.
question na po yan. You
Okay, I
already
will wrap
consumed
up,
your
Madam
3
Chair.
minutes.
We have 37 BHS. 16 of them were constructed in 2017. 2 of them were constructed in 2018. And 13 of them were constructed under local infrastructure program, and 6 of them under BUB. So, kailangan po natin i-prioritize, Mr. Secretary, kasi 2017 pa po napunduhan ito ng HFEP, at we cannot let the BHS na ganun na lang po because they cannot fully function as a health facility kung wala pong mga equipment. But with the assurance of the Honorable Secretary, thank you so much for the effort and concern for the implementation of the BHS program, especially in the 60 District of Pangasinan. So I've heard also that there's a 5.5 billion allocation, unprogrammed amount. How do we intend to disburse or use the amount of 5.5 billion, Mr. Secretary?
DOH.
The 5.5 billion peso unprogrammed fund will most likely be utilized for infrastructure projects. This will again be evaluated by our different regional offices as to what infrastructure projects are to be prioritized. But as I've said earlier, we are asking even for more augmentation to the tune of about 7 billion for additional infrastructure projects, and the rest for additional equipment, and also for medical transport, with a grand total of projects both under the 4.1 billion HFEP approved by the DBM in the NEP. This is largely for equipment at about 1,643 facilities, and an additional 2,890 facilities to be funded through the 7 or 8 billion infrastructure budget. So for a grand total of about 4,533 facilities. Certainly, your district will be included in the list of prioritized infrastructure project, assuming that our request is granted. Thank you.
Mr. Secretary, Madam Chairman, thank you so much for that very responsive response to my district, and I will appeal again for the distribution or provision of BHS in my district as well as medical equipment. Just a final note, Madam Chairman, on the observation of Kong Mike, yung pong clarification na sinasabi po ninyo na yung mga medical equipment, ay ibabato na lang natin sa mga LGUs. Magkakaroon po tayo ng problema doon, I think, sa mga LGUs kung ibibigay po natin sa kanila, kasi yung mga amount po sa medical equipment vary. May 100,000, may 200,000, may 500,000. So depende po yan sa mga LGU, iba-iba bang political landscape ng mga LGUs natin sa mga provinces, especially kung ang congressman hindi po kasama mayor sa isang bayan, hindi po nila pupunduhan ang kanilang inisyatibo. I think mahihirapan po yan because LGUs perceive the BHS, especially equipping of BHS, as a national government function and not devolved function na tatrabahuin po ng mga LGUs. So I think we have to consider that position also, Mr. Secretary. And again, in behalf of the 60 District of Pangasinan, palbalag salamat, Mr. Secretary. Salamat po sa mga suporta nyo sa amin, sa DOH family. Again, thank you so much and God bless.
Thank you, Congressman.
Thank you, Congressman Tyron Agabas. And the next one to interpolate is Representative Bernadette Herrera. You are now recognized.
Thank you very much, Madam Chair. Magandang hapon po, Secretary Duque. Magandang hapon po sa DOH family. Basically naman po yung concern ko is regarding po dun sa COVID-19 testing. I'm sure you're familiar with that one. I want to know now, ano na po yung policy natin when it comes to those who can avail under the A to J na qualified na magkaroon ng free COVID testing. Can they already approach any of the 105 accredited centers so that we could maximize the use of the 29 billion funds that we allocated for the COVID-19 testing, Secretary?
DOH.
Yes, Madam Chair. For as long as the beneficiaries are included in the expanded testing protocol or guidelines, where we have 10 subgroups, then the payment for the testing fees will be for the account of Philhealth.
Alam na po kaya ng mga accredited centers, Mr. Secretary, because nung the last time na nag-check po kami, even the 105, not all 105 accredited Philhealth centers know about it. Kasi para po alam ng mga kababayan natin na pwede po silang pumunta ngayon basta they are qualified under that the qualifications para makapunta po sila sa kahit saang testing facility.
Yes, Madam Chair. I would like to refer the question to SVP Neri Santiago as to what they've been doing to increase awareness of the testing laboratories which are accredited or licensed by the DOH and among the laboratories that citizens within the 10 subgroups may access.
SVP Neri Santiago, you are now recognized.
Yes, Madam Chair, Madam Congresswoman, regarding po this mga information dissemination para sa ating COVID testing area, facilities na accredited, nakalista po sa ating website yung ating accredited testing centers at doon po ay makikita nila kung sino po yung mga accredited natin na testing centers. Tapos po, yung pong mga nag-issue na rin po ng advisory and the circular has been issued regarding the testing. Dun po sa amount po ng ating testing fee and at the same time na no copay po dapat ang COVID testing rates natin. Thank you, Madam
So
Chair.
meaning to say, to you, Madam Chair, kung ako, qualified ako under the A to J requirements of Philhealth, can I go to any testing facility at test po ba nila ako ng libre, courtesy of Philhealth? I am a Philhealth member.
SVP Neri Santiago.
Yes, Madam Chair. Regarding po dun sa requirements natin para maka-avail po and to follow yung guidelines ng DOH na inilabas po nila, expanding the eligibility for the COVID testing, what we have right now is in place, yung pong hanggang A to D pa lang po muna, and we are now exploring the ways in how we can assess kung sino po ang maka-cover dito sa A to J na expanded. Kasi po, parang mas malawak po kasi ang coverage nito tulad ng mga in-expand po natin yung sa tourist locations as well as yung mga economic companies na kailangan mag-exist na po during this pandemic. So, sa ngayon po, pinag-uusapan po namin how we can assess kung sino po ang papasok po dito. And meron naman pong mechanism na the patient can directly file with Philhealth kung sakali man po na hindi nabayaran na hindi na iawas sa pagbabayad nila dun sa facility po na nagte-test. Thank you, Madam Chair.
Kong BH, last question. Kong BH. Thank you. And the next one to interpolate is Deputy Speaker D.B. Sabaliano.
Thank you, Madam Chair. BH, okay na?
Nawala ako sa dali na lang. Sorry, DB. Sorry. Nawala ako eh.
Ikaw na.
Thank you. Ma'am, Madam Chair, through you.
Kong BH, last question.
Yes, thank you. Hindi, kasi this is very important. Sa memorandum nyo, A to J ito. Diba? And we have 30 billion allocated budget for this. Palagay ko yung 105 testing centers can already hindi kayang ubusin eh. So sana naman gawin kaagad natin yung patakaran para anybody na pwedeng magpa-test under your guidelines can go to any accredited Philhealth center. And number 2 and last question ko, Madam Chair, sana po pwede na po bang mag-directly reimburse yung mga qualified sa Philhealth na nakapag-abono na ng kanilang testing? can they directly reimburse from Philhealth?
SPP Neri.
Yes, Madam Chair, thank you po, Congresswoman. Yes po, pwede pong mag-directly file ang ating mga miyembro sa PhilHealth. Kailangan lang po mag-provide ng OR at saka yung waiver from the facility na hindi po sila binawasan ng PhilHealth.
Okay, maraming salamat po. Ma'am Mickey, last na lang talaga. Secretary Duque, are you aware of your earmarked revenues of 1.5 billion balance na po sa December 31? Na meron kayong earmarked revenues amounting to 1.5 billion as of December 31, 2019?
Secretary Duque.
I'm sorry, hindi po malinaw. Can I request for a repeat of the question?
Kong BH, can you repeat your question?
And I'm asking the Secretary, kasi meron silang earmarked revenues amounting to 1.5 billion na balanse noong December 31, 2019. I'm asking if the Secretary is aware of that para we could help them kung anong dapat gawin sa Kongreso para magamit ng lubusan ng pondong ito.
Secretary Duque.
1.5 billion? Ito ba DOH o PhilHealth?
DOH po, Mr. Secretary. Yung total earmarked revenues niyo po from OSEC, Bureau of Quarantine, and FDA, ang balance po niya ay 1.587676 billion as of December 31, 2019 po, Sec.
Ito pong retained income na ito, Congresswoman Bernadette, ay nire-retain po ng mga facilities ng BOQ at saka ng FDA.
Parang sa iba yata yung retained earnings, doon po sa off-budget account, yung sa retained earnings, iba pa po yung earmarked revenue. Anyway, Secretary, baka pwedeng pag-aralan po ng DOH so that we could also know how we could amend the provision para lubusan po nating magamit dahil sayang naman po itong balancing pera na ito.
Oh, yes, ma'am, we will do that.
We just want to, opo, and then sana po makipagtulungan po tayo para we could maximize the budget of DOH po.
Oh, thank you very much, Congressman. Maraming salamat po.
Thank you very much.
Thank you.
Madam Chair, maraming salamat po, Madam Chair.
Thank you, Kong BH. And the next one to interpolate is Deputy Speaker D.B. Sabeliano. You are now recognized.
Yeah, thank you very much, Madam Chair. Ang tanong ko lang kay Secretary, kasi natutuwa ako, naririnig ko laging about syntax eh. At yung mga napupunta niya na itutulong niya sa Department of Health. Pero pag wala na kaya yung industriya ng tabako, which is contributing 147 billion sa DOH, sa Universal Healthcare, saan ho tayo kukuha ng pondo para to support Universal Healthcare?
DOH.
Ang DBM po at saka Department of Finance ang nagpaplano for funding of government programs, projects, and activities. At mahirap po yung inyong katanungan kung saan po kukunin, kung sakasakaling mahinto ang industriyang ito, ay palagay ko ang DBM po at DOF ang may kakayahan po na sagutin itong napakamahirap na tanong po ni Congressman Sabeliano.
Kasi tinatanong ko lang kasi narinig ko lahat ng programa ng DOH galing sa syntax. At nakikita ko rin na parang sa amin naman, yung kay Congressman Agabas nga, na zero pa sa mga sa mga expert niya. Mga tobacco producing provinces ito. Kung pwede sana magtulungan naman tayo. Anyway, yung the tobacco industry, kami mga nasa Northern Luzon, tayong nasa Northern Luzon, tumutulong tayo ng malaki. Yung industry natin, malaki na itutulong. Especially even sa PhilHealth, na narinig nyo na kanina, the syntax from the tobacco industry, we are contributing 71 billion. So, yun ang dapat tignan din natin para itong industry na to hindi mamatay. Kasi medyo nahihirapan na ho siya because ang dami na hong limitations. So, give and take sana tayo regarding this matter. Kasi pag nawala ito, wala na talaga. saan tayo kukuha? Are we getting from the different agencies yung mga pondo nila? Kukunin natin para mapunta sa health? O ano ba, pag-aralan ho natin mabuti kung ano yung future natin kung nawala na yung industriya ng tabako. Then secondly, Madam Chair, yung ang isang concern ko dito, yung sa Philhealth naman, is there a possibility, Mr. Secretary, na maglagay tayo ng personnel from Philhealth na tumutok na sa lahat ng hospital para ma-monitor nila yung mga hospital admissions para mawala yung yung agam-agam o yung kalokohan. Para at least monitor sana lahat. Nakatutok na sila. So yung itong sana pag-aralan nito para makita natin. Then thirdly, Mr. Secretary, if I remember right, at nandiyan si Yusek Kabutahe, Mirna Kabutahe, nagpunta yung DOH noon sa sa Cuba to study the polyclinic model in Cuba. And napag-usapan na Surigao and Ilocos Sur, especially vegan, ang magmo-modeling nito. But until now, wala pa pong nangyayari. 4 years yung term ni Presidente, and I think that was first, yun ho yung mga yung mga first few months or first year or second year na nagpunta sila para pag-aralan kasi naniniwala tayo na maganda yung programa. And I was very happy na vegan was chosen and may pondo na nga nilagay doon, palit lang naman, pero sana ituloy natin to kasi maganda yung programa. Then another thing, Mr. Secretary, alam ni Yusek Mirna Kabutahe, yung concern ko about the development of herbal medicines. Ito yung isang napapabayaan natin na in Asia, tayo na lang yung pinakamahina yung herbal medicines natin. So is there a program for this para naman ma-develop natin yung mga herbal plants natin na dati doon tayo umaasa. And lastly, Mr. Secretary, ang concern ko yung sa infrastructure din ako, hindi ko na pero yung mga programs nyo, yung pagpalakas ng public health natin, yun ang main concern ko because ito yung preventive. Kasi gagawa tayo kung ano man gagawin yung infrastruktura, kung di naman natin may prevent yung yung mga sakit ng tao, then mas malaking problema yun. So, ito lang yung mga gusto ko may consider, Mr. Pag-aralan nyo, and sana matugunan naman itong mga to. And lastly, yung mga promises ko ng DOH, sana especially sa amin sa region, sa district ko, sana ayusin naman para naman na makatulong tayo sa manangailangan. Yun lang, Mr. Secretary.
DOH.
Maraming salamat, Madam Chair and Kong Savillano. Yung pong patungkol sa mga i-deploy ng Philhealth sa mga hospitals para mabantayan at maibsan ang mga fraudulent practices. Meron po tayong 600 na mga Philhealth cares na lumilibot po ito sa mga iba't ibang mga facilities precisely to ensure na mas efficient po yung processing ng mga documents para pag-file sa Philhealth for reimbursement ay mas mabilis. At of course, gaya ng nasabi ko, ay maiiwasan din po ang mga fraudulent practices kung nakabantay ang mga tao ng Philhealth sa mga ospital. Yung pong sa mga ibang issues ay kung pahintulutan ng ating chair, pasa ko muna kay Yusek Mirna ang tungkol sa mga tanong ni Congressman Savillano.
Yusek Kabutahe, you are now recognized.
Thank you, Madam Chair. Thank you, Congressman DV Savillano. Yung pong sa polyclinic, kasama natin po noon si Director Gorgolon. Siya pa rin po ang nakatutok sa programa and pa-follow up po natin para maituloy po yung polyclinic. Doon sa herbal medicines naman po, ina-assure ng Yusek Rosette Barhering, who now handles whose team ay under ang Philippine PITAC, Philippine Institute of Traditional and Health Care na tutukan din po yung herbal medicines. And I'd like to tell the Secretary and the Chair that following the example po ng Ilocos Sur, we work together to provide the AED, Automated External Defibrillator, kasi yun po ang isang request ni Congressman DB noon, nakalagay na po sa budget ng Health Emergency Management Bureau ng 26.4 million para ho bibili ng AED for the whole country. At saka tama po kayo, bibigyan po natin ng tutok lahat po ng iba't ibang public health program, lalong-lalo na yung favorite nyo po na health education, regular health education, sa pamamagitan ng pag-strengthen ng ating Health Promotion Bureau. Maraming salamat, Mr. Chair. Kong, thank you.
Another
Thank you,
follow up lang, Madam Chair. Mr. Secretary, we're giving support to the rural health units, diba? Mga medicines and whatever. Pwede bang bigyan din kami ng report niyan para alam naman namin kung ano yung mga ilalagay namin na tulong para additional sa kanila. Kung saan nila, sa inyo na nagagamitan nila, kung sino yung mga recipients ito, para ma-monitor din namin.
Yes, we will do that, Congressman Didi Savillano.
And lastly, last na to, pero importante para sa atin lahat. Because the Department of Health, meron kayong programa sa water system. Yung how you detect kung ano yung may mga minerals or something. Yun ang isang request ko sa district ko. Because I've been putting up a water system in all the schools kasi gusto kong uminom sila ng potable water. So yun ang naging programa natin doon. But I'm requesting DOH na sana po ay i-check nyo rin yung water na yon. There should be a regular checking para hindi ho magkasakit yung mga bata, especially pag pumasok na po sila. I think ito yung magandang programa sa buong Pilipinas na gawin natin because pag yung if the children will be drinking clean water, mas maano sila yung health nila, mas hindi sila prone sa mga sakit. So ito yung isang pakiusap ko na sana gawan ho na magandang programa to.
Yes, Congressman, we will instruct the Region 1 to do more regular water assay or testing just to ensure its safety for consumption of children, especially those in schools. Thank you, Madam Chair. Thank you, Kong Didi.
Thank you, Madam Chair.
Thank you, Deputy DB. And the next one to interpolate is Representative Sharon Green. Representative Sharon Green. And the next one is Representative Edgar Chato. You are now recognized.
Thank you very much, Madam Chair, and our DOH family and our colleagues. Before anything else, let me thank Secretary Duque, of course, Original Director Bernadas, and the other DOH officials, Director Gorgolon and the rest, for our continued partnership with the province of Bohol, especially my district as well. The molecular laboratory that has already been operational is also a product of joint efforts together with the provincial government. And let me also thank you for our modernization of our hospitals and health system. May I just put in some ideas? Now we are doing the including the immunocompromised groups, senior citizens, PWDs. But earlier we were discussing about the possibility of vaccines being available by we were discussing about how prepared we are and the priority age groups that will be targeted. With the limited resources, I'm also thinking of whether we have also entertained the idea of securing a COVID-free herd of workers in the labor force. This is very much related to our efforts to recover as a country economically and the growth of the economy. We need workers who are COVID-free, and we need them also to be part of the priority for our vaccination activities, hopefully by next year. We know that this will need enormous funds, but this will also augur well for economic growth. May we know if this is being considered by DOH?
Certainly,
DOH.
Madam Chair and Congressman Chato, the DOH is prioritizing this upon the directive of the President. And so, in the budget, there is an allocation of 2.5 billion for COVID-19 vaccines for medical frontliners in public hospitals, DOH, the BJMP, the Bucor, DepEd, DSWD, uniformed personnel of the PNP and the AFP, and the indigent senior citizens. But let me also state for the record that the DOH had requested about 12 billion pesos, uh, precisely to expand those who will be covered with these vaccines. But the NAP reflects only 2.5 billion, which has been approved by the DBM. But the Department of Finance uh, has put together a financing arrangement for possible 20 vaccines good for 20 million Filipinos, and prioritizing the list of people who will be uh, prioritized, and plus a great number of indigent Filipinos, as instructed by the President. So there will be a loan that will be taken out by the PITC Pharma to fund 40 million doses good for 20 million Filipinos, indigents mostly, and that this loan will be paid for by the implementing agency, which is the Department of Health, and the loan payment will be further arranged, whether this will be for 1, 2, or 3 years schedule of repayment. So this is actually still, talks are still ongoing with regard to this. However, back to the issue of the vaccines, uh, we still have a paucity or scarcity of information about the various vaccines, save for the fact that there is now a growing list of vaccines currently on clinical trial phase 3, and that will take about 4 to 6 months, I was told. And the other information that I have is that I think there are 5 or 6 vaccine manufacturing companies that that the DOH and together with the DOST have signed a confidentiality disclosure agreement. This will pave the way for us to get as much information as we would like to guide us insofar as our decision to procure a certain level of or volume of vaccines. But again, the overall consideration is to ensure that these vaccines are compliant with the stringent standards of safety, efficacy, and quality as a major as an overarching consideration. Thank you, Madam Chair.
Madam Chair, I agree entirely with Secretary Duque. It is also very important to stress that the labor force sector, ideally our 6 to 60-year-old population working and able to work must be safeguarded so that the economy can continue, aside from the frontliners who are priority. And another question is about MICA project, Secretary. We thank you for supporting us in the new Galeares Hospital, a 500-bed hospital. in Cortes Town. The 2020 and 2021 budget included already the first tranche of it. Does that imply also that because of the MICA agreement, it will have a continuous release for 2022?
DOH.
Madam Chair, with your permission, may I direct the question to Director Gorgolon?
Director Gorgolon, you are now recognized.
Yes, Madam Chair, Kong Chato, yes, this 1.6 billion that is appropriated for 2021 for Galyares extension at Cortes is the approved MICA appropriation. So with regards 2022, we still have to coordinate with the DBM only if the 1.6 will be used the whole year, for the whole year, so that we can ask for an increase for 2022. Thank you.
Thank you very much, Madam Chair. And one final question. This is about Philhealth. In one of the hearings that I attended, I was asking Philhealth why there is quite a delay. When I was governor, quite a delay in the refund of Philhealth, amounting to over 100 million in the province. And I was told that this is a thing of the past because there is an IRM, so to speak, that is advanced to the hospitals. I understand that this is also the subject of inquiry and investigation now. What will then be the scenario? Are the local hospitals assured still of updated refunds? Because that has been a problem years back.
Yes.
SVP Neri Santiago.
Yes, Madam Chair, Congressman Chato. Yes po, sa ngayon po, medyo bumagal lang po yung ating turnaround time pagdating sa pagbabayad dahil sa pandemya, pero unti-unti na pong bumabalik ang ating pagpaprocess ng claims. At sa ngayon po ay less than 60 naman po ang aming turnaround time pagdating po sa pagbabayad. So, inaasahan po namin na mag-improve po ito habang nagre-relax po tayo pagdating sa ating quarantine.
Okay, final point lang po, Madam Chair. Yung ating Galyares Hospital in Tagbilaran
Chato,
City.
last question na po.
Yes, last question. This is the only government hospital in Tagbilaran City with Don Emilio Hospital in Ubay, which is 100 kilometers away. The important point is Galyares is declared as COVID dedicated hospital. So most of the patients, especially the poor ones, are forced to go to private hospitals with higher charges, of course. And the limitation of the SWD, of the PCSO, and even the Provincial Social Welfare Office has been quite stressful to the poor patients. And we don't have malasakit centers except also in Galyares Hospital. So we hope that DOH can also look into this scenario. There is a coordination with the local district hospitals, but again, the focus on the poor patients adversely affected. Dati po, yung wala pang COVID, yung Galyares Hospital can accommodate most of them together with the district hospitals. But now, the poor patients are really in a problematic situation. Tataas po yung rates ng private hospitals and then nahirapan sila ng tulong. Thank you very much po. Just look into this, DOH, Secretary. Thank you very much. Maraming salamat po, Madam Chair.
We will do that, Madam Chair, Congressman Chato.
DOH.
We will comply. We will look into the request made by Congressman Chato, Madam Chair.
Thank you, Congressman Edgar Chato. And the next one to interpret is Congressman Siriaco Gato. Kong Gato. Representative Sriaco Gato. Okay. And the next one to interpolate is Representative Vice Chair Jonathan Alvarado.
Maraming salamat, Madam Chair. Madam Chair, ngayon po ay sana mabuksan natin yung comment section o kaya yung atin pong people's participation na binukas po ng ating no less than our speaker, Alan Peter Cayetano, para sa publiko na magkaroon po sila ng kaalaman tungkol po sa hearing ng paggawa po ng batas o briefing ng paggawa po ng batas. At Madam Chairwoman, Madam Chairperson, ang aking pong unang babasahin na napangakuan ko po kanina sa comment section ay katanungan po ni Reyna Luna. At bago ko po itanong ang kanyang katanungan, itatanong ko po muna sa DOH, sa international standards po, Madam Chair, ilan po ba ang ratio dapat ng dialysis machine kada tao, Madam Chair?
DOH.
Yusek David, if the chair will permit to look at the ratio of dialysis machines per population.
Yusek David, you are now recognized.
Thank you, Madam Chair. So we have standards for other equipments, pero hahanapin ho namin yung standard for dialysis machines. Hindi ho karaniwang nakikita po yon sa mga international standards. So.
Okay po. Sa kabalan po ng bilang ng international standards, irerekta ko na po yung katanungan ni Miss Reyna Luna. Ang tanong po niya, gaano karami ang nagdadialysis sa Pilipinas, Madam Chair?
Yusek David.
I think the Philhealth database might be able to extract that information.
SBB Neri.
Yes, Madam Chair. Currently po, ang nag-claim po sa Philhealth is about 60,000 patients po. Sa hemodialysis po yan.
Pero ang tanong po ay, gaano karami ang nagdadialysis? Siguro, kung nagpapadialysis po siguro yung sinagot ni Vice SBP Neri Santiago, Madam Chair. Pero ang tanong po ng ating netizen, gaano karami ang nagdadialysis? Siguro malapit doon, pero ilan siguro yung ilan yung pasilidad o dialysis center? Ganon po.
SBP Neri.
Tingnan ko po yung datos namin. Sandali, kung pwede po.
60,000, Madam Chair, ang nagpapadialysis.
Yes po.
Ilan ang dialysis centers po natin?
Madam Chair, our Executive Director of the National Kidney Transplant Institute is on board. Naka-Zoom siya. May I request the Chair to please recognize ED Lequete.
Yes, sir. Good afternoon, everyone. We have probably now more than 40,000 dialysis patients all over the Philippines, and maybe around 900 dialysis centers, because we have a lot of freestanding dialysis centers in the Philippines.
Madam Chair, nalilito po ako kasi ang sagot po ng Philhealth ay more than 60,000, pero yung pangalawang binibini po ay sumagot naman ng more than 40,000. Ano po ba ang tama, Madam Chair?
Sir, Madam Chair, maybe Philhealth claims po yung sinasabi ng Philhealth. But I'm talking about patients on dialysis in the Philippines according to our PRDR. More than 40 na rin yun.